All right, Sonia, I'm making you the host. If you can make me the co-host after. And you are good to go, Senator.
Okay. 1 sec. All right, let me get my script and then we'll get started. All right, and Sonia is the host, is that correct?
Yes.
So Sonia, when we get down to the blanks, I'll ask you to fill in the blanks on email and telephone number. Just giving you a heads up because it's not on my sheet.
Got it.
Okay, ready? Welcome everybody to Senate Health and Human Services. I am Senator Tom Sherman, District 24. I'm the chair of the committee. Today we will be hearing 3 bills and conducting executive session. Before we get started, I'll read through a checklist to ensure that the meeting that we are holding is in compliance with the right to know law. As chair of Senate Health and Human Services, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that, number 1, we are providing public access to the meeting by telephone with additional access possible by video or other electronic means. We are utilizing Zoom and a Zoom meeting for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through the platform. And the public has access to contemporaneously watch and or listen to the meeting on Zoom and via phone by following the directions and links provided on the General Court website. We have provided public notice, number 2, we've provided public notice of the necessary information for accessing the meeting in the Senate calendar. Number 3, we are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email Sonia.
remotesenate@leg.state.nh.us.
Let's do that one more time.
remotesenate@leg.state.nh.us.
Or call
603-271-3043.
once again, that's
603-271-3043.
number 4. In the event the public is unable to access the meeting, will be adjourned and rescheduled. Number 5, please note that all votes taken during this meeting shall be done by roll call vote. Number 6, finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. Sonia, would you call the roll? Or do you want me to? I'll do it. Okay. Senator Fuller Clark.
Here, I'm in York, Maine, and I am by myself, though my husband might wander through.
Senator Chandley.
Good morning. This is Shannon Chandley. I am at home in Amherst and I am alone in the room.
Senator Bradley.
Yeah, good morning, everyone. Jeb Bradley. I am in my home in Wolfboro and
And you froze. Senator Gray.
This is Senator Gray. I'm at my home in Rochester and I'm alone.
Okay. Do we have Senator Bradley back yet or not? Alan? No, Senator Bradley.
I'm going to call him, see if he needs help.
Okay, thanks. I think we can go ahead, though. And therefore, I'm going to open the hearing on HB 1246 relative to reporting of healthcare associated infections. Representative Woods is not on the Zoom, so I asked Senator Chanley to introduce the bill.
Certainly, Mr. Chair. For the record, my name is Shannon Chandley. I represent Senate District 11, which includes the towns of Amherst, Merrimack, Milford, and Wilton. And I would like today to introduce HB 1246 for your consideration. Thank you.
Thank you. I won't does anybody have any questions about 1246? Okay. And it looks like, do we have anybody testifying on the bill?
We do. Paula Minahan had signed up, but I don't see her at the moment, so I'm going to call on Jake Berry.
Okay. Jake, if you could introduce yourself. Is he
Sorry,
coming on?
can you hear me now?
Yep. Hi, Jake.
Wonderful. Good morning, Mr. Chairman, honorable members of the committee. My name is Jake Berry. I'm the Vice President of Policy at New Futures. First, let me apologize. I suppose I should have signed up to speak to the amendment, but would you prefer me to speak to the bill as amended now or to hold off?
Why don't you plan to come back? What would you prefer, Sonia? I don't have a problem with him going ahead, but you want him to wait and come back?
That would probably be best.
Okay,
My apologies. Thank you.
no problem.
I have Paula Minahan now.
Okay. Paula, if you would introduce yourself, you are speaking on the underlying bill 1246.
Yes, good morning, Senator and members of the committee. Can you hear me?
Yes, thank you.
Okay, great. My name is Paula Minahan, Senior Vice President, State Government Relations with the New Hampshire Hospital Association, representing all our hospitals in New Hampshire. With me today remotely to answer any questions is my colleague Ann Diefendorf, who's the Associate Executive Director of the Foundation for Healthy Communities and Vice President of Patient Safety and Quality. We want to thank Representative Woods for introducing this bill, and we are in strong support of House Bill 1246. We continue to see advances in patient safety and quality that can outpace established measures of performance. Adherence to central line insertion practices, or CLIP, and surgical antimicrobial prophylaxis are two examples of this. Both are considered process measures which are ideal when new practices are established to ensure adherence. They become insignificant when those practices become embedded into the culture of daily care and clinical performance. Adherence to CLIP was noted to be 98.3% in the 2018 Healthcare Associated Infection Report. Surgical antimicrobial practices as part of the Surgical Care Improvement Project, or SCIP, was retired in 2017 as a measure by CMS, the Centers for Medicare and Medicaid Services, as it was topped out due to consistently high performance. Rigorous surveillance of infections attributed to central lines and surgical site infections continues as more important outcome measures. Ongoing monitoring of any infections would identify lapses in process, should they occur. In addition, other priority areas such as antibiotic stewardship continues to focus on aspects of these measures or are captured in other required reporting. This bill was amended when it was heard in the House Health and Human Services Committee earlier this year in response to some concerns raised by the Department of Health and Human Services. The Hustle Association and Foundation for Healthy Communities is very supportive of these changes, and we do ask that you support House Bill 1246. Thank you very much for the opportunity to comment. I am happy to answer any questions, or more importantly, my colleague, who's the expert in this area, Ann Diefendorf, can answer any specific questions that you have. Thank you.
Thank you, Paula. Are there any questions from the committee for Paula? Okay, seeing none. Next.
Next, we have Abigail Rogers.
Hello, Abigail.
Hi, good morning, Senator Sherman and members of the committee. I'm Abigail Rogers. I am the legislative liaison for the Division of Public Health Services at DHHS. And I am just calling to testifying today in support of HB 1246. To echo what Paula Minahan said, we work closely with the New Hampshire Hospital Association and the Foundation for Healthy Communities on the language that was amended in the House. And we support the bill and thank Representative Woods for bringing the measure forward.
Thank you so much.
You're welcome.
Any questions for Abigail? Hearing none, I do want to just give a little editorial comment. This actually has nothing to do with the prior two speakers, who were very pithy and which means brief, and but because of the number of speakers we have for today's hearings, we will be doing what we did last week, and we'll be limiting people's remarks to 3 minutes. And the reason is that our time is limited. So I would ask that you don't read from your handwritten testimony, but rather make the most essential points that you want the committee to hear and take home with us and consider during our exec session on the bills. And Paula and Abigail gave beautiful examples of making sure that their testimony was poignant yet pithy. How's that? I like that. A little alliteration for the morning. All right, so moving along, who is next, Sonia?
Courtney Tanner.
Courtney, welcome.
Thank you so much. Can you hear me?
Yep.
Great. I want to thank you so much for moving House Bill 1244. This bill removes 2 unnecessary reporting requirements, as Paula highlighted. House Bill 1246 aligns the effective reporting for New Hampshire DHHS with measures defined and vetted by CDC, CMS, and the National Quality Forum. I also just want to highlight that I did submit written testimony from Alyssa Malcolm, who's our Director of Value Reporting and Analytics at Dartmouth-Hitchcock. I'm happy to take any questions, and I'm also happy to facilitate any conversation with Alyssa.
Thank you. Are there any questions for Courtney? Seeing none, thank you very much. Senator Bradley, you're back. It's good to see you. We missed you.
Yeah, sorry, I don't know what happened.
That's all right. Can you just reintroduce, finish the roll call? You got cut off about halfway through.
Oh, okay. Yeah, Jeb Bradley. I am in Wolfboro, my home, and my wife Karen may come by from time to time.
Okay, thank you very much.
Yep, sorry about that. I don't know what happened, but
No worries. It's technology. Sonia.
So I have one last hand raised. It is Ann Diefendorf.
Okay. Welcome, Ann. Is she unmuted?
She's muted on her end. I have allowed her to talk. There she is.
There she is.
Good morning. I was just letting you know that I was there with Paula.
Okay, thank you. I guess there are no questions. So moving on to the amendment, is that correct?
If there's no one else, I don't see any hands raised, and I've gone through my list for the underlying bill. So I think you can close that.
Okay, we will close the, well, actually, is there any other member of the public who wishes to speak on the underlying bill 1246?
If you're on the phone, you can raise your hand by pressing *9.
Any response? Okay, we are closing the hearing on HB 1246. And we have, I believe, Senator Feltus to introduce the amendment.
Yes.
Senator Feltus, welcome.
Thank you very much, Mr. Chairman. For the record, Dan Feltus, honored to represent Concord, Hopkinton, Henniker, Warner, and Pennacook in the State Senate. Be before you, Mr. Chairman, and Senate HHS once again, albeit virtually. It's great to see everybody. I'm going to walk through the amendment, which you can find on page 163 of the calendar. And before I walk through it, just want to give a broad overview about why it's important. It's important to help our nursing home and long-term care facilities as best we can. It's important for health. It's important for planning. It's important for what's going on right now. And then on top of that, it's important to have ideas and know what's going on at HHS. And what is going on within the budget over there. In addition to that, we'll talk about the Child Care Scholarships Program, but that's essential to the health and well-being of our kids. And as we reopen, making sure working class folks have an opportunity to access that, and enhance that is what that's all about. So section by section, I'll be brief, Mr. Chairman. I'll try to anyways. Section 3. This is the transparency, try to know what exactly is going on within HHS, basic reporting. That's the purpose of that. Section 4 and 5. Section 4 and 5 deal with long-term care and nursing home facilities, taking and transferring $25 million from what's left of the Federal CARES Act monies into a trust fund to help nursing home and long-term care. Purpose of which is to help with everything that they may need, whether it's testing, PPE, video conferencing technology for family members of residents who are on the outside and need to be on the outside. And in addition to that, keeping these facilities open that accept Medicaid to make sure that we don't lose some of these facilities. And certainly the heartbreaking situation that we've seen with the loss of some of our residents also means, to get to the bottom line, it means a loss of some of the reimbursement. So we need to make sure that we help out our facilities, keep them afloat. That's the purpose of this trust fund. The trust fund, the money that does go into the trust fund can be used and will be used for an independent review. That's 151E23 in this amendment, Mr. Chairman, members of the committee. The purpose of that is to take a look at what we need moving forward, and what is going on, what do we need moving forward, and obviously people have talked about the potential for a second wave. Certainly doing the planning to make sure that we take care of nursing home and long-term care in the long term is something that's prudent and well worth the time and the effort. I will note one additional thing with respect to this, Mr. Chairman, members of the committee, and that's that if you see it, look at the last line of the trust fund language, E22, the fund may accept and expend additional funds for the purposes of the section as directed by the governor or the general court through the fiscal committee of the general court. The purpose of that is to, if it's determined that more than 25 million is needed, that language is essential to allow the additional money to come into the trust to bolster the efforts of the trust. And so I just wanted to highlight that because I suspect some of the testimony that comes behind me will say that more than 25 million is needed. Again, that language is there that, and if more money is needed, it allows that to happen. Moving right along to section 6. Section 6, Mr. Chairman, you may, members of the committee may know that the governor, on the advice of the Gopher committees, allocated $25 million from the CARES Act money to go to support childcare. They're in the process, HHS is in the process of working through that and how that will go out the door. This would be $10 million of the federal CARES Act money specifically to support the affordability of childcare by bolstering the Child Care Scholarship Program. It will bolster it both in terms of eligibility, but across tiers. And I would note there would be one edit here, Mr. Chairman. You see it says that expand program eligibility include families between 220%, 250% of federal poverty guidelines. It already goes up to 250% and kind of an in and out kind of formula. So in speaking with some folks, it makes more sense to change the language from between 220% and 250%, change those words to up to 275%. So change between 220% and 250% to up to 275%. Again, the purpose of this is to reach more of the so-called working class folks who need childcare, who in many cases are being called back to work right now, but without childcare being functional right now, and they need access to childcare, and that's good for preventing people from choosing between work and family, and that's only good for the health and well-being of kids. It's only good for the health and well-being of our economy as we continue down the pathway of reopening. Section 7. 7 deals with the administration of vaccines if one becomes available, to allow for a pharmacist or pharmacy intern under the direction of an immunizing pharmacist to administer the COVID-19 vaccine if it becomes available. Again, that's flexibility, planning down the road. Obviously, if we leave session without doing something like this, and a vaccine does become available, it's important to allow this flexibility in the administration of the vaccine. Section 8 is transparency. There's already a requirement, Mr. Chairman, members of the committee, under RSA 9F1 to report all of this information. This is just clarifying that, and in fact, in the CARES Act money, that report needs to be made. And I will note that instead of simply putting it on the Commissioner of the Department of Administrative Services, we say the Governor's Office for Economic Relief and Recovery. There was a suggestion that it's better put there. Well, they could coordinate to do these reports, but having the reports and transparency of where the taxpayer money is going is very important, especially when we talk about all the stuff that's going on in healthcare. So that is a quick summary. I will also add, Mr. Chairman, that I would respectfully suggest the committee consider the addition of Senate Bill 570 to this amendment. Senate Bill 570 deals with LNAs and the reimbursability of Medicaid reimbursability of LNAs in training. We know there's a workforce shortage issue in long-term care and nursing homes, and this would help deal with that issue, reimbursability of LNAs in training. I will note that Senate Bill 570 has bipartisan support. It's sponsored by Senator Khan, co-sponsored by Senator Guida, Senator Ward. It passed the Senate on a voice vote. For whatever reason, we did not, put this in the package or flag it earlier. I apologize for that, Mr. Chairman. But it's really important. In fact, I'll just lay out the importance as stated in Senate Bill 570 and the general court findings. Licensed nursing assistants are the frontline providers of direct care in many settings, including hospitals and nursing homes. New Hampshire has recently seen a net loss of licensed nursing assistants to the detriment of staffing necessary to ensure continuity and quality of care. I think that pretty much says it. It's something we all agree with. And Mr. Chairman, members of the committee, I would respectfully suggest that it's appropriate to add this to this amendment. So thank you very much, Mr. Chairman, members of the committee. I'd be happy to answer any questions.
Thank you, Senator. I just would comment on your comments on 570, which I will take up in exec session, but it's such a crisis that in our work with the senior support team and with the Department of Health and Human Services, that we worked with the long-term care facilities to create a new position called temporary health partners, because we had such a shortage of LNAs, but we needed a position that would work in the Medicaid accepting facilities. And that's one of the reasons why LNAs are so critical, is because they fit into federal guidelines. So I agree 100% with the SB 570 addition. Does anybody on the committee have questions for Senator Feltus? No? Thank you, Senator.
Thank you very much. Appreciate it.
Sonia, before you bring in the first person, just a reminder that we will be asking you to stop at 3 minutes. So please be brief and to the point. Thank you very much. Go ahead, Sonia.
Karen Rounds.
Welcome.
Good morning. I was asked to join the meeting. I'm not sure if there are questions for me.
If you could state your name and where you're from and your connection to the bill.
Sure. I am Karen Rounds. I am the Chief Financial Officer for the Department of Health and Human Services.
And did you have any comments on the bill or any thoughts on the amendment?
No, but I'm happy to take any questions regarding it.
Anyone on the committee have questions for Ms. Rounds? No? Thank you so much. Seeing none.
Oh, there we go.
Hold it.
Oh,
Did you have a question, Senator Bradley?
Yes.
Oh, well, let's get her back then if we can.
sure.
There we are. Ms. Rounds, Senator Bradley does have a question.
Thank you very much, Ms. Rounds. Could you detail some of the initiatives that the governor has already allocated CARES dollars for long-term care? I think the Worker Relief Fund for child abuse and for child care, the CARES money that's already been allocated.
Sure. And I would just mention that most of these programs I know at a very high level, as there are many programs I have not been involved in all of them at a detailed level. I would start with long-term care. There is a long-term care stipend for Medicaid providers for their employees that service Medicaid clients. It was one of the first large initiatives that came from the CARES Act funds. Secondly, just a few weeks ago announced was, I don't want to get the number wrong. I think it's either $20 or $30 million for long-term care from the Healthcare Relief Fund. The final application for that will actually be out the end of this week. And we anticipate those funds going out rather quickly. There is also initiatives in childcare, $20 million initially with some additional funds in reserve coming from the CARES Act fund to help support our childcare system. There are stipends that are approved for our child protection workers. We also received funds to help with domestic violence, as well as some funds to help support the child welfare system to ensure that parents could stay in contact with their children. So those are just some of the high level items. And also just keeping in mind that all of these funds have to be spent by December 31st or obligated by December 31st. So I think one of the childcare changes that are in this amendment do have changes that would take effect through the end of the fiscal year, and the funds would only be available for half of that fiscal year.
Thank you.
Senator Fuller Clark.
My question is with regard to the monies that have already been allocated from the CARES Act for childcare. Are any of those monies going to be dedicated to the scholarship fund for childcare?
Well, first, let me just start with saying thank you, Senator, for your service.
Thank you.
And I think we'll all be sorry to see you go. Yes, my understanding is that some of those funds will be used in the scholarship program.
But is there a specific, sorry, may I follow up?
Sure. Yes.
Is there a specific amount that has been designated that can be used by parents with regard to the scholarship fund?
I'll have to get that information for you. That's one of the programs that I don't know at a detailed level, but I can get you that information.
Thank you so much.
You're welcome.
Are there any other questions? I have one. Senator Bradley tweaked. Rounds, you said that the funds needed to be earmarked, and that could certainly be done within the time frame, even though the period is from July 1, 2020 through June 30th, 2021. If those funds are earmarked for the scholarship, by December, end of December, they would still be usable in that time frame, correct?
I would need to confirm that. Typically with most of our federal grants, they have to have obligated, meaning that they the activity must have happened by that date. So I don't think that activities happening after December 31st would be eligible for those funds. I'm not sure if somebody from Gopher is on the phone. They could definitely answer that question better, but that's not typically how our other federal grants have worked.
So just to summarize the testimony, because I think we need to be very clear about this, is number one, and by the way, this is not at all being critical. It's just sort of a state of where we are. We don't know whether there are any current funds. We don't know for sure whether any current funds are being allocated to the scholarship program. And we don't know whether there really is a time frame problem with the amendment. So at the very least, if the amendment were to go through, you would have through the end of December to bolster the scholarship fund as outlined in the amendment.
Yes.
Okay, thank you. I just want to be clear that we don't have some of these answers, but at the very least, it looks like there would be a, what would that be, 6-month benefit from this, if not longer. Thank you. Are there any other questions for Ms. Rounds? Thank you so much for your testimony. Sonia?
Rebecca Ross.
Ms. Ross, welcome, and please introduce yourself.
Good morning, Mr. Chair and members of the committee. This is Rebecca Ross. I'm General Counsel for DCYF. I am here on behalf of the division to request an additional amendment to this bill. It would be Amendment 1110S to Senate Bill 549. I believe, Mr. Chair, you were provided with a copy of that by John Williams.
Yes, I think that was, do we have that, Monica?
Yes, I can. Do you want me to pull it up on the screen?
Presumption amendment.
Yes, Senator Bradley, this is the rebuttable presumption of harm amendment related to the Child Protection Act and specifically investigations of abuse and neglect, which was closing a gap in some of the instances where children are exposed to serious activity that could likely lead to harm, but without actual demonstration of harm, we have no ability to intervene, specifically including impaired driving, substance misuse, domestic violence, and psychological abuse. We worked on Amendment 1110 with the stakeholders, including the Office of the Child Advocate, Waypoint, Dartmouth, CASA, the Coalition of Domestic and Sexual Violence, and a number of other stakeholders to come to the compromise language that can be seen in Amendment 1110S. And we would seek the committee's support to add that to this bill. And I'm happy to take any questions.
I can share this to the committee as well.
Yeah, if you would, Monica, it looks like I have an amendment. I have amendments to 1639. I don't have 1110S.
Okay, I will send that
So,
to everyone right now.
Senator Bradley, did you have a question?
yeah, no, more a suggestion. I think that the amendment that is in essence Senate Bill 549 is a good amendment, but I think it should go into the omnibus bill. There's support across the board, I think, for that amendment. It was a request of John Williams, and I think it was also considered yesterday by the Judiciary Committee. But I think it would be best in Amendment 639.
So I apologize. I am also just seeing that from John Williams that he.
Yeah, don't worry about it. We're all struggling too.
So I'm sorry, if we could clarify, Ms. Ross, if you could hold on 1 second. Monica, we have that amendment?
Yes, it was just sent.
Okay, to all members, if you want to pull that up. I'm not sure why this would be better, but we can talk about this during exec session, since there is wording in the current bill and amendment that we're discussing on child protection, why this wouldn't be germane to the current amendment. But I guess we can talk about that. Are there any other questions for Ms. Ross? Okay, seeing none.
Senator, I see a hand raised from the phone. I think it's John Williams.
Okay, do we have others? Yeah, if it's John, that's fine.
Good morning, committee and Senator Sherman. This is John Williams, the Director of Legislative Affairs. And I just wanted to thank you for the work that you're doing, but I did want to clarify that the amendment that Attorney Ross was representing, and she did a wonderful job, it just happened to be the wrong bill. Our intention has all along been to take it up in your next omnibus bill involving HB 1639, Amendment 1386S. So when that amendment is taken up on that bill, at that time, we will introduce our commentary. Thank you very much.
Okay, so John, just to clarify, you are wanting to put it into 1639 rather than this bill?
That is correct, Senator Chairman.
Okay. All right, so why don't we discuss it, and we'll discuss all of this during exec. While we have you, John, does anybody have questions for John Williams? All right, thank you, John.
You're welcome.
Senator, I have one more speaker on this amendment. It's Teresa Rosenberger.
Okay. Welcome, Teresa. If you
Good
could
morning.
introduce yourself.
Thank you. I'm Teresa Rosenberger from Divine Millimet, and I'm speaking this morning on behalf of the New Hampshire Healthcare Association. And let me say, first of all, we tremendously appreciate the $25 million for the trust fund. As you know, this has been a very difficult time for the nursing homes, and every little bit of help really does help tremendously. They've been hit really hard with staff flight, with obviously the pandemic. It's demoralizing with all the deaths, and it's been tough. And I will say we're gearing up for a second surge, but it's still ongoing. The daily testing is really what's needed, as well as all the resources that we can muster. So thank you very much for that. I would also say the only concern we have in the amendment is the independent review. The nursing homes think DHHS has done, frankly, an exceptional job. They've listened, they've supported, they've advocated, they've given advice. They've really done a tremendous job working with the nursing homes at this historic time. And so our question is DHHS more the appropriate place to do the review and work with the nursing homes instead of at this point bringing in an independent body? We've also got the study on the safety of nursing homes, and I'm assuming there's another study on the safety of healthcare facilities. And at this point, I will honestly say these folks are just trying to keep their heads above water and function. And then, excuse me, to have an independent person as well as everything else. We were just thinking that if possible, DHHS is the better place and understands the facilities. As you know, prior to the pandemic, New Hampshire had one of the highest rates of compliance and some of the safest nursing homes in the country. And we feel like DHHS has been a tremendous, good and sometimes bad, oversight. There are times, you wish they wouldn't look too closely, but they do, but they've done a good job. So the other thing I would say in this is we tremendously appreciate Senator Feltus bringing in Senate Bill 570. That is much needed. Staffing has been a huge issue. We appreciate you, Senator Sherman, working so hard on the temporary health workers. Staffing is a real problem. So anything you all can do for that would be terrific. I would say this is coming from me, not the Nursing Home Association. It's probably the most depressing thing I do is to be on their call every Friday morning and listen to what's going on across the state. Please, I would request each of you, if you've got an extra 3 minutes, call your nursing homes in your community and just ask them how they are and what they need and thank their staff. They are demoralized and they really do just need to know people care and appreciate how hard they're working, even though things are not sometimes great when you look at the death count. So thank you. I would be happy to answer any questions.
I have a question for you, Teresa,
Okay.
and I second everything you were talking about in terms of where the nursing homes are right now. If we look at this as an independent review, I would just ask you a couple of questions. The first one is, it's been my impression that DHHS has also done the very best they can with resources that initially were very limited, not because of them, but because they were limited all over the country. And so being able to do the best they could with what they had access to was an amazing juggling act that I think they did beautifully. But something that's come out of all of the work that we've done and that DHHS has done and that you've done and the associations have done, it's not that we need anybody saying, boy, something went wrong. And what I agree with the amendment, what we need is what can we learn from what's happened? And as you point out, everybody is flat out. They're doing everything they possibly can to cope with the outbreak. So do you really think that DHHS has the capacity, the manpower, the HR to really do a soup to nuts review so that in a timely fashion, recommendations could come forward that would actually help them look at the needs of nursing homes across the board. You know, with the senior support team, we've been in 71 facilities and looking at everything from PPE to infection control policies and procedures to HR to testing to you know, all of these issues. And it strikes me that it would be very helpful to have somebody come in and look at this from a 30,000 foot view and also at a granular level to say, what can we learn from this whole experience? And I just wonder if they really actually have the resources to do that while they're also trying to fight COVID. So I'd be interested in your thoughts on that since you've been in the trenches with us.
I will say thank you, Senator, because you did just add in one thing I forgot in my testimony, which was to say that one thought was to add staff to DHHS, because you're absolutely right. They have been as straight out as everybody in the nursing homes. I would also say that possibly another thought would be only do one review or one study. You've got the study committee that I think was Senator Morgan's bill originally, I can't remember the bill number, about studying long-term care facilities. And then you've got this independent review. I would respectfully say, could we combine them so that we're only dealing with one study and one review, not two? I also would say, having worked with you in the beginning with that MIT program, there are some clearly good ideas and things that come out of people looking at things with a fresh view. But I do want to be sure that the message that's getting through is just what you said. They are straight out, and to take staff, both DHHS and the nursing homes, and to take people to deal with doing multiple studies or reviews is difficult right now. So
just a comment on the study committee is that was actually a study committee. So the information coming from the review that is done in this bill would be absolutely essential to the study committee as a way of looking at the response. The study committee will not actually be doing an investigation themselves. That's not their role, but having this data available would be really helpful. Would you believe? And are there any questions from other committee members? Seeing none. Thank you, Teresa, for your testimony.
thank you so much for all you've done, Senator.
I would just make a comment to, I believe, Alan, the amendment is ready for 16. I'm just looking, want to get my numbers right.
Yes, Monica has sent it to the committee members, I believe, as well.
Is it on the website? Is it on the website as well? So that people like Paula and others can download it and look at it?
Yeah, Monica's saying yes.
Okay.
Well, it's in the process of being added.
Okay. So just as a small public information announcement, the new amendment to 1639 is being loaded onto the website, and for the committee members, it's now available, and it should be in your inboxes. All right, moving on, Sonia.
So we have a few more speakers on the amendment to 1369.
Didn't Jake want to speak on the amendment?
He does, but Karen Rounds has her hand raised. Would you like me to go to first?
Let's go with Jake next because
Sure.
he's in line.
Jake?
Jake, please introduce yourself again. You may be muted on your end.
So, okay, sorry about that. And I will try to keep it brief so you can get back to Karen. But Mr. Chairman, honorable members of the committee, my name is Jake Berry. Once again, I'm the Vice President of Policy at New Futures. As you may know, we are a nonpartisan, nonprofit health policy and advocacy organization. As New Hampshire's designated Kids Count organization, we advocate for data-driven policies that support granted state families. Certainly, as you've discussed this morning, in different ways, nursing homes, long-term care facilities, and child care centers have all been at the forefront of this COVID-19 crisis, providing essential services to families in need, and each is facing severe financial strain because of it. The financial relief directed under this amendment will go far to help these service providers and to help us care for our children and elders in this time of need. Specifically, I want to highlight the funding provided to support the Child Care Scholarship Program. This will, as has been discussed, this will certainly help families in need return to work to provide for themselves and their children, and certainly to support our economy as we come back from this crisis. And that is it, and I'm happy to take questions.
Thank you. Are there any questions for Jake? Senator Fuller Clark.
Yes, I just wanted to ask Jake, his understanding of the monies allocated already through the CARE Fund by the governor, and are there dollars in there for the child care scholarship? If so, how much, and is that enough?
Senator Fuller Clark, thank you. Thank you for the question. Certainly, I know that as Karen had mentioned earlier on, there have been some funding directed toward childcare. I know that they've recently they've completed an application process for those funds. I can't, unfortunately, I don't know offhand whether, I believe most of it had went directly to centers and not to the scholarship program, but I don't know for certain if that's the case.
Thank you.
Any other questions? Thank you, Jake. Sonia?
So we have two more hands raised, and first is Karen Rounds.
Okay. Welcome back, Karen.
Thank you. Karen Rounds, Chief Financial Officer, Department of Health and Human Services. I was able to connect with a few people and answer a few of your questions, but Senator Fuller Clark, I will still have Chris Santinello reach out to you. So if you would like more details. The funds from the CARES Act for childcare, currently the childcare facilities are applying for those funds. We do expect that some of them will use them for the scholarship, but they may also apply to use them for other purposes as well. We did also receive other federal grants for childcare as part of the CARES Act that are outside of the $1.25 billion of flex funds that Gopher is managing. Those funds, we are still working on how those will be used. We are focusing first on the funds from Gopher. And the reason for that is also the answer to the second question that Senator Sherman had mentioned that we didn't have a solid answer to, which is that the $1.25 billion in CARES Act funds has to be incurred and paid by December 30th. So we cannot incur any costs after December 30th related to that 1.25 billion. So again, we're focusing with childcare on those funds first, and then we'll determine how to use the other grant funds as those have a longer term on them.
Okay, thank you. Any further questions for Ms. Rounds?
I would also just mention that I do have to jump off of this hearing for the governor and council meeting. So John Williams is on the call and he can email me if any other financial questions come up and I'm not available.
Thank you, Karen, for getting back on these issues. And if there's more information, I look forward to receiving it. Thank you.
You're welcome.
Next.
We have Lisa Henderson.
Good morning.
Welcome, Lisa.
Hello, Senator Sherman. My name is Lisa Henderson, and I'm the Executive Director of Leading Age Maine and New Hampshire, and we serve not-for-profit providers of long-term care. and really across the continuum from independent senior housing on through to assisted living, nursing care, and also the state's continuing care retirement communities. I too want to echo Teresa's appreciation for CARES Act dollars in support of long-term care providers. It is desperately needed for all the reasons she articulated. And I did come in with the same question or concern as Teresa about why an independent review and concerns about, is this a solution in search of a problem? You know, I do believe that DHHS is well aware of the challenges COVID has presented. We, among the 3 associations, New Hampshire Healthcare, New Hampshire Arch, serving assisted living providers, host or participate in 4 calls a week that include all DHH staff pertaining to COVID. So we have a very collaborative relationship, and they have been very supportive, obviously, of the efforts of providers. And just something to add in terms of eyes and ears on long-term care. It was just last week that CMS announced that for nursing homes, there will be state survey agencies needing to complete infection control surveys of 100% of CMS certified nursing homes by the end of July. And these are on-site surveys. In addition, there's a further drill down to any facility that has confirmed cases at 10% of their bed capacity, or cumulative confirmed and suspected cases at 20% of bed capacity, and nursing homes with 10 or more deaths due to COVID. So, you know, and within that, there's explicit enforcement remedies for nursing homes and even state survey agencies, and that if the survey agencies don't comply, this could result in a 10% reduction in CARES Act funds, apparently, to the state survey agency. That was new to me in reading the fine print. So I just wanted to point that out, and that they're through that process, you know, being on site to view how providers are managing COVID and prevention and containment practices, you know, there will be insights, I'm sure, that come from that. So will that in fact end up being duplicative to the effort proposed in this bill is a question that I would have. But anyway, you know, again, just want to reiterate CARES Act dollars in the hands of providers to get what they need, and in terms of PPE and, you know, those video conferencing capabilities, supporting staff who are.
Sorry to interrupt, but that's in 3 minutes.
We appreciate it.
Thank you, Lisa. Does anyone on the committee have questions for Lisa? I just have a quick one, similar to what I asked Teresa. Is, you know, all of us who've been involved with DHHS and their response knows how stretched they are. Do you think they could do the comprehensive review so that we can learn from the experience of COVID without having some independent help to look at that? I just see it as a win-win, but it's, you know, we do that all the time in healthcare. We have outside review of our performance, but not in a putative way, but more in a learning way, so that we can improve. And, you know, it used to be called a PIP, a process improvement group. And so just wondering if you see any downside to having that outside review and being able to inform us as we move through COVID, using these available dollars, how we can enhance our response even further.
I definitely understand and appreciate the concern, and I do think that folks are stretched thin, and that's been a long-term challenge. You know, I guess my concern would just be how familiar would that outside entity be with how nursing homes operate, and operate specifically in New Hampshire? Would that learning curve result in you know, mistaken, you know, fault finding because they just need too much ramp up to understand the specific challenges of our providers. So maybe it would depend on, what type of entity is selected. Are they coming at it from, maybe more hospital experience? In which case I would have some concerns because nursing homes just operate differently. If they have true nursing home and assisted living experience and understanding, then that's more promising.
Yeah, I would hope that if there were an RFP, it would be for a group that does this kind of thing with nursing homes, not, I agree 100%, hospitals or other facilities, it's not apples to apples. It's a different entity altogether. Any other questions for Lisa? Seeing none, thank you so much for stopping by.
Certainly.
Sonia.
Senator Sherman, I don't have anyone else on my list for Amendment 1369.
Okay. Are there any members of the public who wish to speak on Amendment 1369? Seeing none, we will close the hearing on the amendment, and I think we already closed it on the bill. And let me just get caught up. So we will open the hearing on HB 1639. And is the prime sponsor here to Representative Snow?
He is. Let me just. Okay, I have Representative Snow.
Great. Welcome, Representative Snow. Would you introduce your bill?
Thank you. I'm Ken Snow. I represent Hillsborough 19, which is Manchester Ward 12, and I serve on the House Health, Human Services, and Elderly Affairs Committee. And I had the pleasure of serving in that committee 2 terms ago with your chairman, Senator Sherman, and enjoyed working with him very much and hope we can have just as productive a meeting today. We're here to talk about House Bill 1639, which has to do with some changes to what we call the In and Out Medicaid program, also sometimes referred to as the Spend Down Medicaid program. Just in a very simple word, it helps people whose income limits are over the qualifying income limit for Medicaid, but have ongoing medical expenses that are way too high for them to meet with that qualifying level of income. So they become eligible for Medicaid as soon as the excess amount of income over and above the income limit is met, and that becomes their spend down. For example, if a person, let me just explain that currently the income limit for Medicaid is, for an individual, is $591 a month, and in a few cases, very few cases, the income level for a household of 2 is $675. But I'm going to take my remarks and talk about individual levels because that's the majority of the people who are on Medicaid in and out. If you just look at it, if with the income qualifying limit set at $596, if a person has a monthly income of $800, that would mean that their spend down would be $209 a month. Very simple. And that can be met with any medical expense, and there's a long list that they have that qualify, including unpaid medical expenses. If you have unpaid bills, but you were billed for it, those unpaid bills can also be counted as part of your spend down. That brings up a problem. Let me just say there are only 7,112 people in the whole state of New Hampshire that qualify for this program. Currently, we're on it at some point during fiscal year 19. 2,461 were individuals with serious mental illness. The remaining 4,651 were individuals with other medical conditions that had the same problem. The one difference with the individuals that have severe mental illness is the mental health centers in New Hampshire are required by law to see everybody regardless of their ability to pay. Most of the people that we see who are mentally ill are very confused about what's required, why they're in and out with Medicaid, why sometimes they qualify, sometimes they don't. And there are lots and lots of tracking problems and the rest that we have to deal with that. So it presents some serious problems for the community mental health centers. Because they don't pay that bill, it generated a level of uncompensated care for the 10 mental health centers of 7 million. Where is it? I've got the number here. It's 7.4 million and change last year alone. And that is really a very hard burden for the community mental health centers during these difficult times to absorb. This bill would go a long way towards solving that problem for the following reasons. What the bill does is raise that qualifying income for individuals from $591 to $901. And for families, it would raise it from 1075. I'm not sorry, not 1075, 675 to 1,047. And what that actually does, if you understand it, would be that for about 25% of the people currently on in and out, their qualifying income is below, is at 901 or below. So they would no longer be part of the in and out program. They would be taken off and placed into one of the managed care Medicaid programs. The other 2/3, 3/4 will remain in the fee-for-service program and continue to be on a spend down, but that spend down would be lowered by $310 a month. This would go a long way towards relieving some of the financial pressures that come to community mental health centers as they serve these individuals. And I would hope that the committee would think seriously about making sure that this original bill 1639 is passed. You may be familiar with it because it was originally part of Senate Bill 308, which was the manpower bill last year, and many of the components of that were absorbed into other bills. But somehow this one never managed to get included in any other bill. So the New Hampshire Association of Community Behavioral Health asked me to bring this bill forward and have it included as a separate bill. It is no longer a totally separate bill because there are a number of amendments. And I have read those amendments and feel very comfortable with them. I did have to register around the amendments as being neutral because I have not had a chance to have a conversation since I first saw the amendment, to talk with the other community mental health centers who are really the stakeholders who asked me to bring this forward. And now there's another addition put on. But I see absolutely no problem with what that amendment brings. Personally, I was very much in favor of it. There may be a couple of very minor wrinkles that we would see as easily corrected in the next session if the group decides to do it. But there's certainly nothing that should hold up this bill this time around. And I hope I'm not speaking out of turn when I say I can see no problem in our committee concurring with you bringing this bill forward with the two amendments. Thank you very much. And if there's any questions, I'd be glad to do my best to answer them.
Senator Sherman, you're muted.
Thank you, Representative Snow. It was a joy to work with you as well. Are there any other questions from the committee? Seeing none, Sonia, I believe the Senate President would like to speak.
Yes.
Welcome, Madam President.
Thank you, Mr. Chairman, members of the committee. Thanks for indulging me at this time to speak to all of you. I'm actually speaking to you regarding two sections of the amendment, Section 60 and Section 61. These were two bills that I was the prime sponsor of that enjoyed bipartisan support, not only in the Senate, but in the House. They're bills that are as important now as when they were introduced, and I hope that you will give them consideration. The first bill was establishing the commission to review drug overuse fatality information and data. This was an issue that had become an executive order during then Governor Hassan's administration. And I believe it is critical at this time, given all the work that we are doing to combat the use of opioids, to actually put this into statute so that the committee is better formed and more empowered to seek data at the time of death and to better understand how we can assist those that are dealing with substance use disorder. I'd be happy to go into more detail, but that's essentially where the bill came from. As I said, it enjoyed bipartisan support. It's something that we had conferred with the governor's office on. Former Police Chief David Mara had input into the issue. And I really think it continues to be an important tool for us, as I said, to address issues surrounding the fatalities that occur when people have struggled with their use of opioids. The second piece is a bill that also had bipartisan support. This bill had not had a hearing, but it is very time sensitive and it's critical. The second piece would establish an opioid abatement trust fund. As many of you know, states around the country, in our state, municipalities and counties are engaged in a lawsuit with the opioid companies and are actively seeking settlement. What this legislation would do is to create a structure, much like we had with tobacco, with MTBE. It would create a structure by which the state of New Hampshire would have a trust so that in the event of settlement, monies could be dispersed immediately to the state and then dispersed to those others who were part of the lawsuit and who were also providing important services as a result of people's addiction to opioids. I believe that someone from the Attorney General's office will be testifying on this legislation as well, as will representation from the Association of Counties. A lot of work and time was put into trying to establish a structure that is, as I said, replicates much of the good work we've done in the past. But it's really important that New Hampshire have this in place as soon as possible. We don't know when the settlement will occur, but in all likelihood it will. And as our economy is opening up more and more, courts are opened, we hope that there will be resolution and that New Hampshire will be positioned well to be able to accept these funds and to be able to help those who are, once again, the entities that have picked up the burden for dealing with those in crisis will see some funds that will assist them moving forward. So those are the two pieces. I truly appreciate the committee's indulgence and would appreciate your support on those two pieces of legislation. Would be happy to answer questions. As I said, if they're super technical though, there will be others that follow, particularly regarding the opioid trust.
Thank you, Madam President. Any questions for the President? Seeing none, thank you for your testimony.
Thank you, Mr. Chairman, and thank you all for the great work we're doing.
All right, Sonia.
Next, we have Edward Laverty.
Welcome, and please introduce yourself.
Hi, Ed Laverty. I'm the Chief Medical Officer at Upper Connecticut Valley Hospital and practicing PA in the emergency department, as well as the former vice president of NISPR. And I was just here to lend support to the advanced directive portion of this bill and on PA licensure to go to twice a year, to once every 2 years instead of every year. I think the most important piece is the advanced directive piece, since PAs work collaboratively with patients and their supervising physicians. It's a natural fit to allow us to go ahead and do the advanced directive with the patient, since many patients have a very close symbiotic relationship with their PA. And in rural areas like I'm from, it's even more important because a lot of times they don't see their primary physician but once a year. or if that. So there's a very close working relationship there. And in a crisis, hopefully advanced directives have been done before the crisis occurs. But in a crisis, it's nice for the person who's dealing with that patient be able to honor their wishes at the end of life. I find more all the time in the emergency department, people are not prepared for end of life decision making and discussions, and nor have their plans all the time been put into place. So unfortunately, occasionally people may have resuscitations done that they didn't necessarily want because their physician hasn't had time to sign an advanced directive order that may have been discussed in the office, but the patient ended up in the ED within a day or two. So not to take up a lot of your time this morning, but I just wanted to put that out there, knowing that in North Country Healthcare, which is the 3 hospitals and the home health in the northern New Hampshire, we have 25 practicing PAs, and a lot of discussion goes on around advanced directives and the end of life decision making currently, and this will just enhance that.
Thank you so much for your testimony. Are there any questions for Mr. Laverty? Seeing none. Thank you so much.
Thank you.
I just wanted to make sure people understood we're still on the bill, and we will certainly take the President's and Mr. Laverty's testimony into account when we get to the amendment. Are there any more wanting to testify on the actual bill 1639?
Yes. Michael Auerbach had registered to speak on the bill. However, I don't see him right now, so I'm going to call on Erica Bodwell and just ask that if Michael is here and wants to speak to the bill, that he raise his hand.
Hi, this is Erica Bodwell. I am Vice President and General Counsel at Northeast Delta Dental. Can folks hear me?
Yes.
You can hear me? Okay, good. I just want to make sure. So I'm Erica Bodwell, Vice President and General Counsel at Northeast Delta Dental. We do support the non-covered services bill, and we have worked out with the New Hampshire Dental Society the language that makes sense to us as the biggest payer in New Hampshire. We do want to just put something on the record. It's come up so quickly that we didn't have much of a chance to talk with Mike Auerbach about it, and he can speak to it. But the bill contains a definition of dental services, which is defined in the bill. This would not and has never included personal protective equipment, PPE, which dentists and all healthcare providers and many industries are very concerned with at the moment, is not considered a dental service. That is considered part of the overhead, like keeping the lights on and paying the mortgage or the rent. So we would just like to, I just would like that to be on the record that that it's understood that PPE, given this extraordinary time, is not considered a dental service. So therefore, dentists would not be permitted under this bill to charge patients for PPE. That's all I have, unless there are any questions.
If I could just ask, I don't remember PPE actually being in the bill. Is it actually specifically in the bill?
No,
so that's a concern, or are you just making the point that it wouldn't be covered?
So Senator Sherman, we just learned, the day before yesterday, I believe, or earlier, late last week, about the hearing coming up today, and we're so grateful that you all are working online. I can't say how impressive it is, and my 24-year-old son, who's hoping to run for office someday, actually snapped a picture of you all on Zoom to send to his friends. But anyway, apart from that, it is not in the bill because PPE was not really a concern or a question, Senator Sherman, at the time that the bill was written. We did, I believe we tried to give you guys an amendment that just had a line to the effect that dental services did not include personal protective equipment. I don't know where that went or if that could get in, but I just did want it on the record. I don't believe we have a dispute at all with the Dental Society, but it just things happening so quickly, but it was not covered in the bill when we talked about it the last time.
Right. Just a question, comment. Would you believe, I can't imagine in the healthcare world on the medical side that we would ever ask for coverage for PPE from our insurers. But it's an interesting point you raise, and we can certainly discuss it in exec session.
Okay, yeah, we do not, our processing policies right now, as well as all the other carriers in terms of dental carriers, do not and have never permitted the patient, neither, we don't pay separately for PPE, nor do we allow, and our biggest concern is not so much us paying for it, but patients are not, their dentists are not allowed to charge patients for PPE. That's long-standing policy. Now, whether our fees increase or so on and so forth, that's part of the normal course of things as expenses increase. So
Okay.
thank you.
Are there any questions from committee members? Seeing none, thank you so much.
Thank you.
Senator, I've been told that Michael Auerbach actually wants to testify on the amendment, not the bill. So I have gone through my list of speakers for House Bill 1639.
Okay, is there any other member of the public wishing to speak on the underlying bills, HB 1639? None?
No.
Okay, we'll close the hearing on the bill, and I would like to introduce, we'll open the hearing on Amendment 1421S. Is that available now on the website, Monica?
It has not gone on the website yet. We have not heard back from IT.
Okay. So what we'll do is, this is very similar to the one that was available, which was, I believe, 1386S, correct?
Correct.
So we will walk through this slowly and carefully, and Senator Bradley says he will be happy to help me. And I think John Williams has some changes very early on. So as we walk through, can we, is John on the call, on the Zoom?
Let me just, yes, do you want me to bring him in?
Please. And I will put him on the spot.
Senator Sherman, good morning. Again, for the record, this is John Williams, the Director of Legislative Affairs for Health and Human Services. And I want to thank you on behalf of the department for allowing us to speak in support of the current amendment to HB 1639, which is 1386S. We also look forward to the updated amendment that you referenced, and I'm going to make my commentary based upon the current amendment 1386S, if that's okay with you.
John, yeah, what I'd like to do is at least start out, I'm going to introduce 1421S, which incorporates the requested changes. And so I would like you to help us understand those changes.
Yes.
So you had asked, and I'm just starting at the very beginning. We have in and out medical assistance. And then we have in section 2, communicable disease. And this is where you ask to replace sections 2 and 3 with the amendment from Senator Fuller Clark. Could you?
That is correct.
Right. Would you mind walking us through that amendment? Because that is replacing sections 2 and 3 in the amendment.
Absolutely. Thank you very much, Senator Sherman and committee members. Those two sections represent a department requested bill sponsored by Senator Fuller Clark, which was SB 507. The bill was heard before your committee, and however, due to the COVID-19 matter, that the ultimate hearing on the bill with this amendment never took place. So the amendment that we would like to offer, and I believe Sonia has it for distribution to the committee members, and it is amendment number 2020-0879S. And I'll hold off to make sure the committee members have a copy of that amendment.
Do all the committee members have a copy of Amendment 1421S that we're going from? Have you downloaded those off your?
Can you, it was 141S. Say that again. Just say the number to me again.
1421S.
Okay, yeah.
Monica had sent it to you, Senator Chanley.
Yep.
So Senator Sherman, if the updated amendment that you have on 1421S reflects the substitution of those sections based upon the other prior amendment provided, the department is very grateful for that inclusion. It just makes minor changes to the bill to add around medication as for distribution as it relates to communicable diseases. It just added from the original text of the bill as introduced, including both drugs and testing and agents and drugs. So it had an expansive course. So for things such as antibiotics and vaccines that would be necessary during public health, and that we'd capture those as well. And it's the legislation itself is very directed to current events as it relates to the COVID-19 response.
So yes, John, so what the amendment that I introduced, 1421S, does is it puts the amendment you just referenced, 0879S, in section 2. So if you would just review for the committee what
I sent it to you, John, as well just now so that you could see it.
What 0879S does. Maybe you just did, but if you could do it again, just to be sure the committee's clear, because we're all kind of catching up.
Certainly, and also on the line, I have Abigail Rogers, who is prepared to get into a little of the subject matter, but I think I can handle it at this point. Again, just restating, in Amendment 1421S, which is now the current updated version, which, thank you, Monica, I do have the updated version in front of me. It does reflect the replacement of sections 2 and 3 of the bill, which was the underlying bill for Senate Bill 507. And the language here does reflect the updated language from the bill as introduced. The bill, as you currently see before you, is responsive to allowing for the distribution of medications as it relates to communicable diseases, as it relates to public health incidents and or declared states of emergency. So this is a very, very helpful legislation as it relates to the COVID-19 response. And you'll see, based upon the bold italics in there, that these are the addition to current law, current state law, that would help us be more responsive and nimble in those in those settings, as well as the current situation we're dealing with. Any questions for the committee? Happy to take them. And I'd also offer up Abigail Rogers as a resource as well.
Okay, thank you. For now, I'm just trying to catch up since we just got this amendment and make sure that, so I think we're all set for now, John. Except, actually, did you want to go through
the other two amendments?
Yes.
Yes, thank you. And thank you for your indulgence. The next amendment that the department was requesting, and I've not located in the current revised amendment, but it dealt with a bill that was scheduled for a public hearing before your committee on March 17th. Because of the legislative suspension due to COVID-19, that hearing never took place. It's a very simple, straightforward bill. It is Senate Bill 45 relative to the New Hampshire Granted Advantage Healthcare Trust Fund, and a bill was prime sponsored by Senator Jeb Bradley. The bill is very simple in its wording, and it is in response to a directive that we received from the Centers for Medicare and Medicaid Services that the directive was that our state law was not compliant with federal law in that the sought to be struck language regarding grants, donations, and gifts is not allowable under federal law to match with the federal match as it relates to the Medicaid expansion program. So this bill is critically important because it would bring our state law or remove those provisions in state law that are not consistent with federal law.
Okay. And any other changes that you had requested?
And the next one, and Attorney Rebecca Ross, I know she has signed up to speak. This is in fact the bill we were seeking to add Amendment 2020-1110S, which is an amendment to Senate Bill 549, to bring to the committee's attention. The Senate Judiciary Committee did add this language at the request of the department yesterday, and they did exec it out with a committee amendment on HB 1162 Amendment 1396S. But because this is such a critically important bill as it relates to the fact that our current law relative to the rebuttable presumption of harm is set to sunset on June 30th, that we felt the need to proceed in making sure that we had it secured in this bill, this amendment to the bill as well, under the new amendment 1421S. And I would invite Senator Sherman, if Rebecca Ross is on the line, if you have any questions regarding the need for this, she is available to provide commentary or respond to questions.
Okay, and we can go through that when we get to that.
Senator Sherman.
Yes, Senator Bradley.
So I haven't been able to find the rebuttable presumption language yet, but the other one that John Williams just referenced on Medicaid expansion is page 36, section 59, starting on line 31.
And that was a late bill that you filed, correct, Senator Bradley?
That's correct. Yeah, that was the one that the hearing never happened, but there should be no controversy about it, as John explained. It's just making our statute consistent with federal law.
Right.
And Senator Sherman, if I might comment, the amendment that was passed unanimously out of Judiciary yesterday, what was the number of the amendment?
1220 or something like that.
I think it was 1417S. And it was page 20, line 22, included the provisions of SB 549. And that bill passed out of Judiciary yesterday unanimously. It's an excellent bill. It's a crucial bill. And I really think that if we started trying to patch everything we want to pass into every bill, it might fit in. As much as I, completely respect the request of Rebecca Ross and Mr. Williams, and maybe this is better left for executive session, but I did want to point out it is in there and it was supported by all members of the committee.
And just to be clear, it is not currently in our amendment.
Correct.
That's correct. Okay. All right. Thank you. Let's continue to muddle our way through this. And I think there is a mistake in this new amendment that we'll need to rectify in exec session. But as we walk through, you will notice following in section 3 of the new amendment, this is new wording that was agreed to by the providers and the carriers, coming from HB 531. And so you'll see a change there where the first paragraph, which is Roman 1, is kept intact. The second paragraph, which has to do with interfacility benefits, is just minimally changed with some wording change. Roman 3 is about interfacility transports and allows for interfacility transport for biologically based mental illness. To clarify that, you may recall last session, we had the issue of transporting patients to New Hampshire Hospital and whether there was a medical role for that. And we did pass that bill and it was signed by the governor, but this codifies that who pays for that transport. It also applies the change that we wordsmith also allows if you have a patient in a hospital that does not offer mental behavioral health services, if they have a patient, for example, who's overdosed with something like acetaminophen, is still a danger to themselves, needs an IEA, and needs to go to New Hampshire Hospital after they're medically stabilized, this would cover that transport as well. Section 4 was actually was meant to replace what is still in here and isn't supposed to be in here, 5, 6, and 7. So that, so those will need to come out in exec session, I believe, but hopefully Heidi Kroll can make sure that I'm correct about that. But section 4, the agreement there is that all prior authorizations under group health insurance policies and managed care basically made during COVID, you don't have to go back and get another prior auth for it. In other words, it's extended for 120 days after May 4th, which was the governor's, when the governor allowed us to go back to work in the hospitals. So this would give a 4-month period after May 4th, where we would not have to go back and get another prior auth. Those prior authorizations will be good for that extension. And I would ask Heidi to speak to section 5, and I believe 6, and possibly 7. Let me just make sure. No, 5 and 6.
Senator Sherman.
Yes, sir.
So section 6 is the oral chemotherapy language. That was my bill. That's a separate bill. It's separate from section 5.
Okay, so it's just section 5.
It's
section
just
5.
section 5. And I
Right.
believe it's lines 26 through 35 that the agreement should not have included that language, but it was left in. So I
Right.
think that
So that's it. Just, you're right. Thank you, Senator Bradley. So it's just section 5.
that
All
when we
right.
get to exec session, we'll remove that.
Yes, and and Senator Bradley, since you're there, if you wouldn't mind talking about section 6, your oral.
Yeah, well, I mean, this is one of the earliest bills of the session. It just, when we passed parity for oral and intravenous chemotherapy, because one's a drug and one's a medical procedure, that was done 5 years ago. It sunsets, I believe, at the end of this year. So without repealing the sunset, which is what section 6 does, the parity that we established between oral and intravenous chemo will expire, and then people will be subject to extraordinarily high, in some cases, costs for oral chemotherapy drugs. There was no controversy about this at all.
Okay, thank you. Moving on to the pharmacy rights during audit, which is the new section 10. And in the old version, because this is a change to the old version, if you look back at the old version, section 16 has been deleted. And section 16 was the line where a pharmacy shall be provided with a phone number for directly contacting the auditor. That deletion was agreed to during the hearing of that bill, and it was not incorporated in this amendment, so that is deleted in the new amendment. Just make sure that that's the case.
Senator Sherman, I believe that is the case. I've gotten confirmation that it's no longer there. So we're good on that.
Okay, and moving along, the State Health Improvement Plan in section 16, that is incorporating my bill. It has been modified by the department. Do we still have John Williams on?
Yes.
John, do you want to explain, Lisa Morris had concerns about the original amendment version, and so we incorporated wording from the department. Are you able to speak to that?
Senator Sherman, thank you. For the record again, John Williams, Director of Legislative Affairs. And we do have Abigail Rogers on the line, and she was prepared to provide some commentary. Director Morris is obviously very busy right now with COVID-19 and not available. But we are absolutely, we are absolutely fine with the wording that you have set forth in this updated amendment. But I defer to Abigail if she has anything else to offer.
Why don't we come back to Abigail? Unless, Sonia, you have her right there.
Sure, I can bring her in.
Okay. Hi, Abigail. Can you just tell us briefly about those changes?
Sure. Good morning, Senator Sherman, members of the committee. I had signed up to speak on the amendment, and John had covered the pieces for the department. The one piece that we have left over here was to comment on the language that originally was in SB 718. Wanted to thank Senator Sherman very much for all of your work on this bill. It's been terrific to collaborate with you on this important work that the department does on the state health assessment and state health improvement plan. We are fine with changes that were amended in the amendment. I just wanted to reiterate this is establishing this advisory council to do the important work to look at health outcomes and reduce disparities and focus on social indicators of health is appreciated, and we are fine with the language as represented.
Okay, thank you.
Senator Sherman, can we backtrack for one moment?
Right.
To section 14.
Right. Just remember, Senator, I'm just introducing the bill rather than we're not in exec yet, but happy to go back.
Okay, well, you had asked me to, as we're explaining it. I can't remember whose bill this was. I think it may have been Senator Morgan's. I've apologized. I've forgotten the number. It dealt with, could have been Senator Rosenwald, unfair dental services. I believe there's agreement on this language, but the citation is incorrect. So I just want to highlight that this is a new add-on in the bill.
Thank you. Yes, that was brought by Delta Dental and the carriers, as well as, we did check with Senator Rosenwald, and she was fine with that change. It just changes where it is in statute. I appreciate that.
Thank you.
Thank you. And John, you're still on the in section 20. The coverage for long-term antibiotic therapy for tick-borne illness, you had a change there?
Senator Sherman, thank you. Can you hear me?
Yep.
So we had earlier made a request around this section because what it provides for in the commercial insurance realm is for various sections that deal with coverage for the testing and treatment around tick-borne illnesses and diseases. You know, on further review of this, because it doesn't impact Medicaid, previously we did make a request, and certainly I think it's for thoughtful consideration the effective date for this sections or the corresponding sections of the bill to pushing it out towards the end of the current biennium so that it could be addressed in the 22-23 budget. Out of respect to the fact that it addresses actually for commercial insurance versus those for Medicaid, we still think that the current effective date generally of 60 days after passage is something that perhaps your committee may want to discuss, but we're withdrawing our immediate request of pushing out those effective dates because upon thoughtful consideration, it did not impact, those sections of the insurance law did not impact either Medicaid or Medicaid managed care.
Okay. Thank you. The next is section 26. We've already heard some testimony on this. This is the one that allows PAs to join physicians and APRNs in discussion of end-of-life care. It's fairly direct. The words physician assistant and PA are just inserted throughout statute in the appropriate places, making it possible for them to have those discussions and do advanced directives.
Senator Sherman?
Yes, sir.
So, good bill. This, I believe, passed through our committee unanimously.
It did.
It was one of the ones that you asked to be added a little late in the process. But I am glad to say it absolutely should be in this bill.
Great.
So thank you. Yep.
The next one is section 51, I believe. I'm sorry, 50, which is again another PA bill. One of the COVID-related processes for many of these bills have to do with manpower issues or person power issues, and certainly having adequate physician assistants to assist during a period of pandemic is critical. As we heard, the section 50 deals with license renewals. It now matches physician license renewals, which is every 2 years. That was the most important part of that section.
And if I could jump in again, I believe this probably went to ED&A, but you're absolutely correct. This is a good bill, and I'm glad we're including it.
Right. Thank you. The next is section 51. Section 51 came from SB 620, which was my bill. This wording has been worked out with the carriers, and it is dealing with reimbursement parity for behavioral health services. The reason that they initially objected to SB 620 was because the metric we were using to determine parity was, in the words of Paula Rogers, was apples to oranges. And the goal here is to make it more apples to apples so that parity is more consistent. The measures of parity are more consistent with what type of practice, whether it's hospital-based or independent practice or those kind of things. The second part of SB 620 is captured in section 52, which is again a compromise between the carriers and the providers to make sure that the process of prior authorization is not an impediment to prompt treatment with MAT, and that and we all realize that if there are delays or speed bumps in the road to access to MAT, it sharply increases the risk of relapse. Section 53,
Can I just comment?
please do.
Again, you know, a lot of compromise here worked out between the carriers and the insurance companies. I think, you know, this, especially Section 52, goes back to work that started, you know, under former Governor Hassan and the commission to make sure that prior authorizations were reasonable. So I just want to give you a shout out on this one too.
Yeah, and that also came from the other bill, I think it was 570. I'm getting number soup here, but the one that we earlier looked at also had a provision on MAT and opioids and prior authorization. So we combined them into one phrase.
Yeah.
53, the Senate President did a nice job of introducing this component. I would note that at the request of the Medical Society, on page 29, line 5, a representative of the New Hampshire Medical Society was added to this commission. This is the, and then section 55, again, is the Opioid Abatement Trust Fund, which the Senate President already talked about. And let me just make sure. And as in the section 56, again, is the how do we handle the consumer protection settlement funds? Section 58 is directly COVID related, which allows pharmacists to administer a COVID-19 vaccine if it becomes available. Section 60 was discussed by the Senate President. Section 61. Patient Bill of Rights. Senator Bradley, did you want to mention this one? This was your bill.
Yes, thank you very much. We had this bill in front of our committee. I believe there was a unanimous vote and went on the consent calendar with an amendment. It just makes sure that anyone is not denied appropriate care on the basis of all the listed, you know, sex, gender, identity, sexual orientation, etc. And then the second piece, which is section 62, it just expands parent, minor, spouse, unmarried partner. That's pretty critical today, or a personal representative chosen by the patient. And I know somebody that, you know, recently confronted this, and this change would allow the personal representative chosen by the patient to be included in law. And again, there was no opposition, as I recall, to this bill.
Correct. It was the original version. We took out a section that was somewhat controversial, and that and it passed clearly.
Correct. I'm sorry. Yeah, I forgot that.
Right. So there is in section 63, this is also Senator Bradley's bill. This was focused initially on teaching hospitals and pelvic exams. The amendment really makes it gender non-specific and talks about sensitive examinations. This has been, since the introduction of the original bill by Senator Bradley, we have seen national news in this being a concern across the country. And so the amendment, which was my amendment to Senator Bradley's bill, generalized this across sensitive exams with input. Actually, some of the modeling was from a Wisconsin Board of Medicine rule. And then it was vetted by, I actually talked to the Attorney General's office, to our counsel in the Senate, and also to Dartmouth Hitchcock about it. So the point here is that this stays in the boards. It's generalized to any medical provider who is doing these exams. And the bottom line is that you have to have consent and you have to have clear indication to proceed with the examination. And Senator Bradley, did you have a comment?
Excellent summary, and I'm glad that we were able to make this happen. Thank you.
The next section is section 64. This resulted from a study committee that was chaired by Senator Bradley, and I was on it as well. We have agreement between the Hospital Association and the urgent care areas on this wording, which was what was the sticking point. The final amendment on this, and I just need to find this. Make sure
I
it
think
made
you're
it.
talking about page 38, line 25.
Correct. So the final amendment that allowed this to move forward after much back and forth was lines 25 through 29. And this is actually fairly standard, that both parties need to agree to the independent reviewer, and if they cannot agree within a time frame, then the independent reviewer will be appointed by the commissioner. I just want to give a shout out to Senator Bradley for his work on this and for the flexibility of the Hospital Association and Paula Minahan, and for the flexibility of Convenient MD and Dr. Punt, and really people coming together to get something done that I think vastly improves the current system. Senator Bradley, did you have any comment on that?
No, again, I'm glad that everybody was able to come together. I believe there may be a couple of typos that when we get into executive session, we can look at.
Okay. And I believe that's it. I apologize for having gone through that so slowly, and but I think since we all just got it, it's helpful to do that. And at this point from the committee, are there any questions on this amendment before we start taking testimony on it? Seeing none. Sonia? But yes, go ahead.
I had Senator Fuller Clark registered to speak on this. Senator, do you want to testify now?
I would like to testify now. I'm awash in papers here, but what I wanted really to talk about was the inclusion of Senate Bill 507 as amended, and just talk about the importance of the amendment that is requiring insurers to waive cost sharing in coronavirus testing and to establish certain protections with regard to coronavirus. It's very timely. The bill initially was timely, but by adding this additional language, I think we're really addressing a concern that everyone has about people worried perhaps about the cost of testing and therefore not being willing to get tested when it's so important that they do become tested. So I just wanted to thank the other co-signers on the amendments, which are Senator Feltes, Senator Wallner, and Senator Lay. And I don't have any additional corrections or changes. I think it's also important to recognize that the rest of the language in the amendment deals with applicable statutes and trying just to make sure that the allowances provided in the act are addressed legislatively. So thank you very much for allowing me to speak.
Thank you. I also want to just make a quick comment on this amendment. We often say thank you to OLS and to our staff. I think something beyond a thank you is worthy of the work that OLS has done to make this possible. It's a Herculean effort to have put this amendment together in the last 24 hours. And I just want to extend more than a thank you to them, and also to our staff for all the work they have done on this. So with that, any other committee members that wanted to speak? Sonia?
No, I don't believe so.
Okay. So if we could start with testimony.
Yes, I just wanted to mention that we have a lot of speakers. So I want to remind people that Aaron will be interjecting when they hit the 3-minute mark to let them know.
Yes. Thank you.
Yep, we had Representative Ken Snow wanting to speak on this, but I don't see him now, so I'll keep an eye out for him. But in the meantime, I'm going to call on James Buffetti.
Sir, if you could introduce yourself.
Good morning. This is James Buffetti. I'm an Associate Attorney General. I'm also the lead counsel in the state's opioid litigation, and I'm only here to speak in support of that section of the bill that creates the Opioid Abatement Trust Fund. As Senator Susi said, this is a time-sensitive issue. The state has brought a number of lawsuits against opioid manufacturers and opioid distributors, and we have been participating for years now in discussions with other state AGs and the manufacturers and distributors in terms of trying to reach a settlement. This opioid trust fund would be in anticipation of reaching settlements with these companies. It is modeled on what the legislature did when we received the MTBE funding for the Drinking Water and Groundwater Trust Fund. As Senator Susi said, there are about 22 political subdivisions in New Hampshire which have also brought lawsuits. And we have been engaging with them now for quite a while and talking to a number of those folks to try and get to common ground on setting up a trust fund that would be a way of directing any settlement funds that the state, any political subdivision in the state would receive. The reason it's time sensitive is that these settlements are more than likely going to contain a provision that there be some sort of a advisory commission made up of a wide range of individuals throughout New Hampshire to direct the spending of this money. In the case of Purdue Pharma, which had filed bankruptcy, the bankruptcy judge has indicated that any funds that would come to the state through the bankruptcy court would have to be solely for abatement purposes and would need to have this sort of a counsel in place. So there was a small group of people who worked with us to try and work through the issues. We didn't work through all the issues. There was still some disagreement, but the amendment that is there is what the Department of Justice feels comfortable with and provides not only for membership of the commission for the direction of how those funds would be spent, but also a listing of approved uses of opioid abatement funds. I'm happy to answer any questions, Henry.
Thank you, sir. Are there any questions for Mr. Buffetti? Seeing none.
Michelle Heaton.
Ms. Heaton, if you would introduce yourself.
Hi, I'm Michelle Heaton, and I'm the Administrative Hearings Judge for the Insurance Department. And I'm here to speak about what is in the current amendment 1421S, Section 13, line 4. I'm sorry, Section 13, page 4, lines 19 through 23. This language is taken from what used to be SB 693, which is a request of the department to allow for flexibility for health insurance companies writing Medicare Advantage plans in New Hampshire, which will especially benefit those consumers living in rural areas of the states where there is limited HMO networks. I've submitted written testimony prior to the hearing. In addition to myself, Doug Bartlett is also present from the department, and we're here to answer any questions you may have.
Thank you. Can you give me the exact section again? That is it section 13? Is that what you said or no?
Yes, section 13, page 4, lines 9 through 23. And it'll make amendments to RSA 420B7 by inserting paragraph 10. Or sorry, paragraph 11 after.
Paragraph 11, yes. Okay. Got it. Thank you very much. Are there any questions for Ms. Heaton or Judge Heaton? Seeing none, thank you so much for coming and testifying.
Thank you.
Ms. Heaton, Doug Bartlett is my next speaker. Should I call on him or is he just here for questions?
He is just here for questions as well.
Thank you.
Do we have any questions for Doug? Okay. Thank you. Next.
Tyler Brannon.
Welcome, Tyler.
Thank you. Tyler Brannon, Director of Health Economics with the New Hampshire Insurance Department. And we don't have a position on the bill or the amendment, but I do want to address a couple of concerns just with two sections. And the first is now section 14, page 4 in the most recent amendment. This has to do with the dental non-covered services. And there was some discussion about this as to where it ends up in statute. That was part of the concern, and part of the reason for that is the New Hampshire insurance statutes actually have a separate section for Delta Dental. And unless you kind of link the two correctly, Delta Dental is not subject to most of the insurance laws. But within the Delta Dental section, there is a reference to what laws they are subject to. The amendment actually references Delta Dental, so it's not something we can't sort out. But the underlying concern is just that with the passage of this language, the result would be that a patient would pay more for their dental services at the time of service. When you go to an in-network provider, you get the benefit of the contract that's in place between the carrier and the healthcare provider, and that's true on the medical side as well as the dental side. But this would result in the patient paying more, probably the dentist charge for many of these services, which in result would the dentist would end up with more revenues, but may lose some of the patient services that would have taken place from patients that are otherwise price sensitive. The other section I wanted to bring your attention to is now section 51 on page 27. It has to do with reimbursement parity for mental health services. There's a federal mental health parity law that goes back to 2008, but that is actually about coverage of mental health services. The department's done an exam of our carriers and found that documentation in terms of compliance with that federal law was not to our satisfaction. But that again had to do with coverage. This specific language has to do with reimbursement levels, which may be explained for other factors as to why they're different between the mental health providers and some of the others on your physical health. Requiring actual reimbursement parity among providers would be a new and unusual role for an insurance regulator, and any increases in provider reimbursement may increase the cost for premium payers. I just want to bring your attention to the fact that New Hampshire has made a lot of recent changes as it relates to mental health policy, including coverage expectations, requiring the department to do periodic market conduct examinations, and raising the standards for network adequacy requirements for access to mental health services. Improvements through telemedicine is also likely to have a substantial impact on access to mental health treatment. And the department will be evaluating the outcome of these changes over time. So I'm going to stop there, and I'm happy to take any questions you might have.
Yeah, I have a question, Tyler. The section you just cited, which I'm having trouble finding, that was on page what again?
It's in the most recent one. It's now section 51 on page 27.
That's why I'm not finding it. That language was provided by the carriers, and it was represented to me that they had checked with you and the department on it. Do you feel that it actually accomplishes the original goal, which was to make sure that we are compliant and that there is apples to apples coverage, so that if one of the major concerns of the 10-year mental health plan from the Department of Health and Human Services was disparity and basically under reimbursement of the behavioral health providers when compared to other providers such as primary care. Are we hitting the mark on this, or is this not going to be effective?
It's certainly, I think, to the extent that you're trying to create sort of greater parity between reimbursement in the mental health community with another side of the healthcare provider system, and in this case, focusing on primary care providers, it is a step in that direction. When we provided the results of our analysis during the exam, we showed reimbursement levels by provider specialty as it is relative to Medicare. And one of the comments that we heard back from the carriers was that the type of analysis we used could be misleading because the reality is that hospitals had a fair amount of bargaining leverage with insurance companies. And to the extent the hospitals employed certain types of providers, then those providers would naturally have higher reimbursement levels. And that's independent of any potentially discriminatory practices that could otherwise be in place for some group of providers, and obviously focusing on the mental health providers. So the language I think that you've got as an update technically works. It's something that the department could certainly take a look at in terms of enforcement. But I think to answer your question about whether or not it would be an overall sort of broad comparison between all primary care providers and all mental health providers, the legislation or the draft, that the most recent draft, focuses just on primary care providers that are not employed by hospitals.
Okay, thank you. Any other questions for Tyler? Seeing none, thank you so much.
Thank you.
Sonia?
Former Senator Matthew Hood.
Senator Hood, thank you for joining us.
Thanks for having me. Thank you, Senator Sherman and members of the committee. I actually wanted to comment on an omission from the bill, if I could. And very quickly, and by way of background, during the COVID pandemic, certain patients with severe advanced COVID symptoms would present at hospitals in the state without responding well to conventional treatments. Experimental treatments and or clinical trials, however, exist that could be an option of last resort for these patients. Current statutory provisions, however, preclude an agent or a surrogate from consenting on behalf of a patient incapable of granting consent. By working with HHS officials and the governor's office, the governor issued emergency order number 39, enabling consent in this context. However, we're not certain, of course, when the EO will be lifted, and so we felt it was imperative to continue the exception until the legislature could revisit the issue fully next session. So my request would be either to parrot the language in EO 39 or simply reference to continue until lifted or July 1, 2021. Thank you, and I'm happy to answer any questions.
Yes, actually, that was supposed to have been included, so we can talk about that. I have the language. It was sent to OLS, and here it is. This is the language. You have a new section, E and F to RSA 137J5, correct? Notwithstanding the prohibition in section D for any patient experiencing severe advanced, is that what you're referring to?
Precisely, thank you, Senator.
Okay, so
And
my
I-
apologies that that was supposed to be included. As you've heard, it was a rather long night for OLS, so we will take that up in exec session to see if we can add that. If you wouldn't mind sending that over to Monica so she can get it to the committee members. It's brief and I can read it when we get there and we can talk about it at that point. And again, my apologies, Mr. Hood.
No apologies necessary. I understand well how significant the effort is both on the legislator's part and on OLS. And so I appreciate your consideration at this juncture.
Okay. Any questions from the committee for Senator Hood? Senator Bradley, you're
Yeah,
muted.
thank you. Yeah, good morning, Senator Hood. This was not in the original amendment that was published in the calendar. Is that correct?
That's
correct.
Okay. That's it. Yeah, no, I think it's a good idea, and I agree with Senator Sherman. We should include it.
Thank you very much again for your consideration. It truly may be an option of last resort for people who are suffering from severe COVID symptoms and don't have another option. And again, I'm just fearful that we don't know when the EO will be lifted and when the legislature will have a chance to reconvene for a full debate on that particular topic.
Sounds good. Thank you. Any other questions? And Monica, can you distribute that? That should be somewhere, maybe Matthew could send a fresh copy over to you and then you could distribute that to the senators on the committee. Okay.
Thanks so much.
Thank you. Sonia?
Paula Minahan.
Hi, Paula.
Good morning. Thank you, Mr. Chairman, members of the committee. My name is Paula Minahan, Senior Vice President, State Government Relations for the New Hampshire Hospital Association, representing all our hospitals. The Hospital Association is in strong support of HB 1639 as amended, and we do want to thank you, Senator Sherman, Senator Bradley, and all the members of the committee that have done a tremendous amount of work on the amendment before us today, number 1421S. While we did just receive the committee amendment, I was able to speed read through it, and the review that you both did was very helpful, and I will just comment on a few sections that impact our hospitals directly. Specifically, the prior auth section, medication-assisted treatment, the special healthcare services license provision, and the New Hampshire Drug Overdose Fatality Review Commission. Regarding the prior auth section, we did work with AHIP and the carriers on this language, and we are in agreement with the amendment. We also are in agreement with the suggested changes that both Senator Sherman and Senator Bradley have commented on, so we are fine with that. We do appreciate the inclusion of the medication-assisted treatment language on page 27, lines 26 through 37. And we also appreciate the creation of the commission to review information and data regarding the drug overdose fatalities in New Hampshire. We are supportive of this commission, and we appreciate that the Hospital Association has a seat on this important commission. And we must thank Senator Bradley tremendously and Senator Sherman for all your work on Senate Bill 519. As mentioned earlier, it has been amended. We are in complete agreement with the amendment, and we do believe that this bill is vitally important to our critical access hospitals. And again, thank you very much. Thank you, and I am happy to answer any questions.
Any questions for Paula? Senator Bradley?
It was brought to my attention some of the typos in the Senate Bill 519 section toward the end of the bill. Will you stay on the call, Paula, so that when we get to exec session, we can walk through it? And if there are any questions, you'll still be available.
Absolutely, Senator.
Thank you. Thanks.
I also want to take this opportunity to mention that we are in complete support of adding the clinical trials language that was identified by Matthew Hood from Dartmouth. And I just wanted to be on record as identifying that as well.
Great, thank you. Next.
Linda Martino.
Welcome, Linda.
Good morning. Good morning, Chairman Sherman and committee members. I appreciate you allowing me to speak today, and I will be brief. For the record, my name is Linda Martino. I'm a PA representing the New Hampshire Society of PAs and also the New Hampshire Medical Society, for which I'm a council member. Both are in support of, I hope I have it right, Section 49 and Section 50 of 421S. In reference to the licensure of physician's assistants, the New Hampshire Society of PAs met with the Board of Medicine. We have their support and working later with them once this hopefully gets passed. And in reference to the act of adding physician assistants to the law governing advanced directives, it's so important, which allows continuity of care at the most vulnerable time in a patient's life. So with that, I appreciate the comments earlier very much from Senator Bradley in support of these. And one last thing I'd like to say is if you don't mind, a little shout out to a lot of PA students that are on the call today, witnessing the legislature in action. So with that, I'll take any questions. Thank you so much.
Thank you, Linda. Are there any questions from the committee? Thank you so much.
Gail Brown.
Good morning.
Welcome.
Can you hear me now?
Yeah.
Thank you so much for the opportunity to speak with you this morning. I am Gail Brown. I'm the director at the New Hampshire Oral Health Coalition. And I want to speak to the non-covered services issue. And hopefully I signed up in the right place, because I can see this applies to 1639 as well as both amendments. So I just wanted to go there. We have a very simple, first of all, I did want to say that as the New Hampshire Oral Health Coalition, our focus is on access to oral health care and dental services that are affordable and accessible for people throughout New Hampshire. Our ask today to your committee is to provide some time for the consumers, the providers, and the stakeholders to further explore the scope of this legislation and its potential consumer impact. We feel that this is not an issue of such urgency that we should not clarify some of the following. What are the services that would be non-covered under this bill? We heard both Ms. Bodwell talk about PPE and need for clarification there, as well as a request from Mr. Brannon from the Department of Insurance to just make sure that we are working from a collaborative definition so that we understand what the impact is on patients. We've been following this legislation potential legislation since it was introduced in SB 749, a bill that was actually late filed, and we were then trying to catch up with what was occurring. Once again, and we totally understand the work you're all doing around urgent COVID issues, it has come on the scene quickly. So we still have not taken that time to be able to clarify what this is. Due to the COVID situation, the system and field of oral health and dental provision is facing significant but changes that need to be looked at, and that as we develop new systems and practices, we feel that it's important before making reimbursement policy to slow down and see what the service of care is going to look like. We are thankful for the transfer of this legislation from the Commerce Committee into this Health Committee. We are thankful for your interest in moving it forward very quickly, but we feel that we need some discussion on how to implement it, how to define it, as well as further discussion on the impact on health economically health disparate individuals within New Hampshire. So we have four simple points. One is we would like to talk more about what does non-covered services mean? Are we talking, as Ms. Bodwell pointed out, clarifying around PPE? Are we talking about tooth whitening, implants?
Sorry to interrupt. That's 3 minutes.
Are we talking about root canals? So we ask simply to be able to move forward with more discussion and not to rush through this. Thank you.
Thank you very much. Any questions from the committee? Seeing none. Thank you. Sonia?
Paula Rogers.
Good morning, Paula.
Good morning. Good morning, Chairman Sherman, and good morning, members of the Health and Human Services Committee. For the record, my name is Paula Rogers, and I am here on behalf of Anthem Blue Cross and Blue Shield in New Hampshire. So I'm going to cut right to the issue that Senator Sherman brought up on section 51 on page 27 in Amendment 1421S. And I also pick up on the colloquy between Senator Sherman and Tyler Branham from the Insurance Department. It's accurate that the carriers are in pretty comfortable agreement with the language that now appears in 1421S, beginning at on page 27, with one reservation. And I just point out, technically, I think, Senator Sherman, that an inadvertent drop of a second paragraph that was in that section, which would have been parens lowercase b, was dropped. So you would find it in the 1386S amendment. And when 1421S was constructed, there was an inadvertent drop of that second paragraph.
Okay.
So if that were reinserted, I think that would make the department very happy, and the plans are happy with that language anyway.
All right.
Turning to the paragraph at issue in 1421, I really appreciate the fact that there was a lot of discussion, mostly with Senator Sherman and Senator Bradley, about the issue of what should the department have in hand as a metric, as Senator Sherman titled it, that would give the department some comfort that they could review carrier reimbursement in a fundamentally fair way to determine whether that reimbursement is fair to providers of BH and SUD services. And I think the language that is in there now in 1421 amended, as amended, I think that gets us to a point where carriers are comfortable and the department feels it has something in hand that it can fairly apply when reviewing carrier reimbursements. I want to point out also that I think this is a very preliminary matter. I'm not sure there's any other state that has gone this far as to put some sort of a metric into statute. So it's a significant step. Will it need adjustment going forward as both the regulator learns and carriers learn where it may still have some deficiencies or where it needs some further strengthening? So I think it's a great start. I appreciate the time on this. It's a complicated matter and it's a very important matter.
And just, Paula, you are absolutely right that paragraph B was not to have been taken out. And thank you for picking up on that. It should be after Roman 5-B, there should be an A in parentheses, and then that paragraph, and then that should be followed by a B in parentheses, and then the language starting with compliance with subparagraph A. So we will get that reinserted.
Thank you.
And just so that everybody knows, that language that Senator Sherman referenced is at the bottom of page 276 in the calendar amendment.
Yeah. All right. Any other questions for Paula?
Thank you very much.
Thank you.
Michael Padmore.
Good morning, Mike.
Good morning. Can you hear me?
Yeah.
Well, thank you, Mr. Chairman and members of the committee. For the record, my name is Mike Padmore. I'm the Director of Advocacy for the New Hampshire Medical Society. I'll be brief, and I'm going to be testifying in a couple different provisions. So would love to just state our support for the amendment language that has been previously discussed around SB 531 around prior authorization procedures under a group health insurance policies and managed care. We worked with a number of different stakeholders on that and are happy with the language and are happy to support it. Would also like to thank you for addressing the piece around the New Hampshire Drug Overdose Fatality Review Commission. We would love to be added to the commission. In addition, you had mentioned the language around mental health parity in Senate Bill 739 being added in. That's another bill that we worked on with the New Hampshire Psychiatric Society and are very happy that that was included as well. And then finally, would just like to state our support for the language from Senate Bill 597 and Senate Bill 598 regarding PA licensure. Would like to echo Linda Martino's comments and Ed Laverty's comments and just say that the Medical Society is in full support of both of those bills. With that, thank you and happy to answer any questions.
Thank you, Mike. Are there any questions from the committee? Thank you so much.
Thank you.
Anya?
Michael Rollo.
Good morning, Mike. Is he muted? Mr. Rollo, if you could unmute yourself.
Sorry about that, Mr. Chairman. My computer wanted me to refresh as my moment to shine here on the committee. So I apologize for that. We're all suffering from technical issues. Anyways, for the record, my name is Mike Rollo. I'm the Director of Government Relations for the American Cancer Society Cancer Action Network here in New Hampshire. And I'm here in support of, well, it was Amendment 1386S, page 3, line 20 to 21. I think you mentioned, I don't have a copy of the amendment, Mr. Chairman, but I believe it was 1421S, Section 6. It's the, what was once known, or still is, I guess, Senate Bill 619, the oral chemo parity. A sunset repeal bill. We're fully in support of that. We want to thank you for its inclusion, especially in the inclusion in the bipartisan omnibus bill and not some other vehicle. And thank you to Senator Bradley for his leadership on this issue over the past 5 years. This is the top priority really for the Cancer Society this year. If this doesn't pass on January 1st, of next year, this benefit will go away and costs will rise for some cancer patients. So we would thank you for its inclusion, and I'm happy to take any questions.
Any questions for Mr. Rollo? Thank you so much.
Thank you.
Jake Berry.
Jake, welcome back. Muted?
Yeah.
No, I'm sorry. Can you hear me now?
Yep.
Great. All right, Mr. Chairman, honorable members of the committee, once again, Jake Berry from New Futures. I apologize. I realized after I registered that my colleague Kate Fry had also signed up to speak on another provision, but I did want to offer our support very briefly, specifically for the the Fatal Overdose Review Commission. We know that this commission, when it was first created by executive order, was hampered by a lack of access to data and lapsed shortly thereafter until it met recently. Looking ahead, we think that given increased access to data and expanded into a full commission, that this commission could play an essential role in informing our legislative efforts in helping us to overcome the ongoing addiction epidemic. So we hope that we support the inclusion of that provision of this amendment and hope that it will move forward.
Thank you. Any questions for Mr. Perry? Seeing none.
Heidi Kroll.
Welcome, Heidi.
Good morning, Mr. Chairman and members of the committee. Can you hear me okay?
Mhm.
Great, thank you. Good morning, everyone, and thank you very much for the opportunity to testify today on the new amendment, Amendment 1421S. I want to thank Senator Sherman and Senator Bradley and the providers and a whole host of other people who have really worked very collaboratively over the last couple days, and we very much appreciate that. I'll just hit a few highlights. As has been discussed, the prior authorization section, we did reach agreement on that. That's in the early part of the amendment. We do agree that on page 2, lines 25 through 30, did I write that down? 25 through the end, and then on page 3, lines 1 through 3 need to be deleted, as was mentioned earlier. But we appreciate the efforts there in coming to agreement. To the extent, moving next to the dental services section, which I believe is section 14, page 4, lines 24 through 26. To the extent that the committee, I know that there have been some potential concerns raised by consumers on the policies in this section, but to the extent the committee decides to leave this in the bill, we do support changing the statutory reference to being RSA 420J:8, a new section F after existing E.
So that change that you requested was not picked up?
I believe it's still making, that is correct, sir. I think that it's still referring to RSA 417:4.
Yeah.
And there had been, I think, agreement among the various stakeholders that at least the appropriate statutory reference should be 420J:8, new section F.
Right, and I spoke with Senator Rosenwald on that. I think it was hers, and she was
Yes,
fine with that.
she is the prime sponsor of that bill. So just wanted to note that we are, if that language stays in, we are supportive of that statutory change, reference change. Jumping to section 10 of the bill, this is the pharmacy audit provision. We simply just wanted to note that I know that this has been worked on. The decrease from 24 months to 6 months is significant. And of course, carriers always want to be able to watch and monitor and identify potential fraud, waste, and abuse. And so, we will continue to monitor how these new changes work.
Sorry to interrupt, but that's been 3 minutes.
Okay, thank you. I just have one more item to mention. So anyway, on that, we will just, continue to monitor how that works. And obviously, if we see concerns, we'll bring that back to the attention of the legislature. And finally, with respect to the mental health parity provisions that are in section 51, the new section 51, we would agree with the change that Paula Rogers mentioned about pulling in the language that was dropped, and certainly appreciate Senator Sherman's work on this and your offer, Mr. Chairman, to continue to work further if we find that further tweaks are needed to that legislation. And with that, I will end and happy to answer any questions. And again, very much appreciate all the hard work that went into this in the last several days. And earlier in the legislative process as well.
Thank you. Any questions? Seeing none, thank you so much.
Thank you.
Michael Auerbach.
Mr. Auerbach, welcome.
Thank you, Mr. Chairman, and the members of the committee. I appreciate your time. I apologize for the delay earlier. I'm up in the North Country delivering PPE to the dentists, dental practices, community health centers, and everywhere else. So I apologize for this inconsistency. For the record, my name is Michael Auerbach. I'm the Executive Director of the New Hampshire Dental Society. We are a statewide professional organization representing over 1,000 members of the dental profession, including dentists, dental hygienists, dental assistants, and dental practice managers. Is to advocate for the practice of dentistry and the advancement of the oral health of the public, and those two concepts are not mutually exclusive. In the spirit of that mission, New Hampshire Dental Society proudly supports HB 1639 FN as amended by number 1386S. In particular, we would like to state our support of the amendment's provision regarding non-covered dental services. We've been working on this for months now with the various stakeholders, including Delta Dental and AHIP. This language represents a patient-friendly approach to dental care cost setting, which, as you know, is a very high priority right now in the COVID era. It would prevent dental insurance plans from setting fees for dental procedures that are not covered by the plans. Those policies placing a maximum fee on non-covered services are known as non-covered services policies. Currently, dental insurance providers in New Hampshire can set rates for mostly elective procedures outside the normal realm of dental care, such as veneers and tooth whitening. Dentists who are asked by their patients to perform such procedures are subjected to preset fees calculated by dental insurance companies that often fail to take into consideration the complexities and associated costs of those procedures. We have been working, non-covered services policies do not necessarily interfere with the patient-dental relationship. In some cases, the imposed reimbursement level is too low, leaving the dentist unable to perform the procedure. What we're looking to do is create some equity in that field. This forces the situation forces the patient to either seek treatment from another dentist who is not under contract or with a dental insurance company, or forego the procedure altogether. Right now, we are in an important phase of healthcare where we're trying to get costs be as transparent as possible to make sure that we deal with a growing oral health crisis. As just to address earlier concerns, non-covered services do not produce any quantifiable overall savings. It represents a cost shifting. But 39 states have thus far enacted laws prohibiting this practice, and there have been no reported increases in costs to consumers. According to data collected by the ADA from those states, there is no evidence of consumer complaints against dentists using this framework to increase costs.
But that's been 3 minutes.
Thank you. So I just would like to reiterate, we have submitted written testimony, but we are very much in support of this amendment as written, and we are greatly appreciative of the leadership's efforts to include this in the health bill. Thank you.
Senator, you're unmuted.
Any questions for Mr. Auerbach? Thank you so much. Next.
Thank you.
Curtis Berry.
Good morning.
Good morning, Curtis.
Thank you for the time and the opportunity this morning, Chair Sherman and members of the committee. I am Curtis Berry on behalf of the Pharmaceutical Care Management Association, which is the National Trade Association for the PBM industry. PCMA's interest is in the subject in what is now, I believe, sections 9 through 12 in Amendment 1421. But as Senator Sherman mentioned in going through the amendment, confirmed by Senator Bradley, the language in what was section 16 of the previous amendment has been removed. That was a section that PCMA had particular interest in and had objected to. With that removed, we have no further comment on the amendment.
Great. Thank you, Curtis.
Thank you.
Any questions for Mr. Berry? All right, next.
Quentin Goebel.
Mr. Goebel?
Oh. Can you hear? Hi, this is Kate Fry. I'm not sure why my husband's name showed up. This is Kate Fry from New Futures. Thank you all very much for all your hard work on this amendment and everything else in front of you. My colleague Jake Berry already spoke to one portion of the amendment, and I'm just going to touch on the opioid abatement trust fund. And overall, we support many aspects of the amendments, and we are so pleased that the opioid abatement trust fund as well is in this amendment. This is something that New Futures wholeheartedly supports to make sure that funding to address this issue is being used in the appropriate places. We would like to just suggest some friendly amendments, and we're happy to provide them if that's okay. We would like to maybe have an overall language that the fund be used for evidence-based prevention, treatment, and recovery services. Also, in addition, to ensure that all voices of the substance use disorder continuum are representative on the advisory committee, we'd love to have that number of seat increase from 1 to 3. I think you have a seat that covers prevention, treatment, and recovery, but ideally maybe you could have 3 separate seats, and they could be held by the Governor's Commission task force chairs who address those issues. I know that's additional seats, but we really feel it's important to have a balance to address the whole continuum. We'd also like to see just a little bit of additional language about prevention, and in terms of opioids in particular. There could be enhanced language about efforts such as enhancing prescription drug take-back efforts. I think you're all familiar that the state has 2 days within the year that the public health networks and the police departments work really hard on prescription drug take-back efforts, but it would be great if there was additional supports in this area that could be funded in other prevention efforts. So we're happy to provide this language if the committee is interested, and we want to thank Senator Susi for addressing this original bill, which is Senate Bill 762.
Thank you. Any questions from the committee? If I could just ask Kate, if you do want to provide any language for us to discuss during exec session, we need it sort of now. And
okay.
You could send it to Monica, and then we can discuss those possible changes.
Okay, I would be happy to do that. Thank you all very much.
Thank you.
Catherine Cole.
Ms. Cole, welcome.
Good morning, Mr. Chairman and members of the committee. My name is Katie Cole, and I'm here to testify on behalf of Tufts Health Freedom Plan. We appreciate the opportunity to voice our support for the Amendment 1421S that was submitted this morning. The compromise language born out of Senator Sherman's Senate Bill 620 and Senator Morgan's Senate Bill 531 was the result of a lot of hard work and collaboration on behalf of the bill's sponsors, the carriers, and the Hospital Association, and addresses the major concerns that the carriers had. One of Tufts' concerns with the original bills when contemplating mental health parity, that we want to be comparing providers based in similar professional licensure and certification and taking an apples to apples approach. So Senator Sherman, to your earlier point when introducing the amendment, I believe this amendment takes that into account and does just that. We're also very supportive of the compromise, replacing Section 5 entirely with the provision in Section 4 that extends prior authorizations that were set to expire during the public health emergency for 120 days following May 4th, when the providers were able to resume the elective procedures. So I just want to thank you, Senator Sherman, Senator Bradley, Senator Morgan, and to the members of the committee for your leadership on these issues. And with that, I'd love to conclude my remarks and take any questions.
Thank you. Any questions from the committee? Seeing none, thank you. Sonia?
Thank you. Courtney Tanner.
Welcome, Ms. Tanner.
Thank you so much. Can you hear me?
Yep.
Great. I will be brief because much of my testimony has already been shared with the committee. But first, I want to thank Senator Sherman and Senator Bradley for considering the additional 19 clinical trials. Dartmouth, Hitchcock, and other hospitals have needed to rely on these allowances granted in Emergency Order 39 to care for patients in this unique situation. As Matthew stated earlier, this amendment will ensure that patients experiencing severe COVID-19 symptoms have access to the care they need, particularly in the event that the emergency order goes away before the legislature can convene again. Second, I want to thank the carriers for their amendment that extends the life of prior authorizations for healthcare services that were set to expire during the stay-at-home orders, specifically March 13th through May 4th, 220 days after May 4th. This provision will allow patients to access care that was needed before the state of emergency without an additional administrative barrier. And that language is specifically on page 2, lines 21 through 25. So thank you to the carriers. Thank you so much to the committee, and I'm happy to take questions.
Any questions for Ms. Tanner? Thank you, Courtney. Sonia?
Erica Bodwell.
Ms. Bodwell, welcome. Ms. Bodwell, you may be muted. I'm sorry. Sonia, let's go to the next person and maybe Erica can get back in touch with us.
So that's everyone on my list except Edward Laverty had signed up, but I don't see him anymore. So Mr. Laverty, if you are on here, if you could raise your hand. If you're on the phone, you can press *9. Other than that, I also had
Hi, it's Erica Bodwell. I'm so sorry.
I think you were muted. Go ahead.
Remind me, I'm sorry, I just missed the last topic. Was it to testify on the non-covered services bill?
This is, you are in the middle of the hearing on the amendment for HB 1639.
Okay, I'm so sorry. This is Erica Bodwell, Vice President and General Counsel with Delta Dental, and my earlier testimony applies. I think I got confused and signed up to testify in both places, so I apologize.
No problem.
Crazy online challenges, but thank you.
Fine.
Thank you, Senator
Thank you.
Sherman.
All right, take care. Okay.
Senator Rebecca Ross has a hand up.
Okay. Ms. Ross? You may be muted.
Chairman Sherman and members of the committee, my name is Rebecca Ross. I am General Counsel and Legislative Liaison for the Division for Children, Youth, and Families. I apologize for the confusion earlier. I am here to request the committee's addition of the language from the original bill, SB 549, which was then incorporated into Amendment 1110S regarding the rebuttable presumption of harm under the Child Protection Act be included in this bill as well. As John Williams mentioned previously during this hearing, that the language in 169C is going to sunset on June 30 of this year, and without the inclusion of this bill, this legislative session, we will be without the means to address individual children who are experiencing neglect based on substance misuse of their parents. Additionally, this bill adds impaired driving, domestic violence, and psychological abuse to the rebuttable presumption of harm bill in order to give us the tools to protect vulnerable children. I'm happy to take questions at any time.
Yeah, I just have a clarification. So this was presented earlier. Did you mean to have it on this bill, not the earlier bill?
Yes, that was the department's intention to include it in this bill.
Now, the second question is, my understanding is that it's included on a judiciary bill yesterday.
Yes.
Okay, and so the interest in having it on two bills is just to be sure it goes through, or?
Yes, I would defer to John Williams on some of this because he had some of the conversations as well. But the sunset of this bill and the timing is critical, that we do not have a gap. And so not knowing what's going to happen with the timing, it's imperative that we focus on this bill as our highest priority for the session.
Okay, Thank you so much. Are there any questions from the committee? All right, thank you so much. Is there any other member of the public wishing to testify?
Well, question for you, Abigail Rogers. I know she spoke briefly when you introduced it. Should we see if she has something she wants to add at this point? Or
Does she have her hand up?
she doesn't have her hand up, but she did register to speak on it. So,
We can check with her.
okay.
Ms. Rogers, did you have anything you wanted to add at this point?
Hi, Senator Sherman. It's Abigail Rogers, Legislative Liaison, DPHS. No, I do have nothing further to add based on my comments of this morning. Thank you very much.
Great, thank you. Any other hands up?
Yes. Sarah Aiken.
Okay, Sarah? You may be muted if you're, Ms. Aiken, you're on.
Can you hear me okay?
Yeah?
Great. Good morning. Thank you, Senator Sherman. For the record, my name is Sarah Aiken. I represent Community Bridges, one of 10 area agencies that support people with developmental disabilities here in the greater Merrimack County area. I just wanted to touch base very briefly in support of what was Amendment 1372S relative to establishing a dental benefit under the state's Medicaid program. I just wanted to say, Community Bridges and the area agencies have been waiting for a very, very long time to be able to support the individuals that we serve in their oral health needs. As you know, oral health, it greatly impacts a person's overall health, and folks who are on Medicaid aren't adults who are on Medicaid haven't been able to access dental benefits in the state of New Hampshire in my recollection ever. So this would be a huge opportunity for the folks that we serve to get access to oral health. It's something we've been waiting for and working on for a very long time, and I just wanted to extend my gratitude to all of you who have worked on this, specifically Senator Rosenwald, who's been a champion of this effort for some time. I'm happy to answer any specific questions, but I think it's generally pretty straightforward. This is really just a roadmap on how to move forward on an issue that was codified into law via the budget last session. So with that, I'm happy to take any questions, and I just thank you guys all for your time.
So Sarah, I just want to make sure, are you referring to the HB 250, which is for
Yes, sir.
dental? Okay, we're still on the bill before it.
Oh, sorry about that.
Oh, no worries. Are you going to stick around, or do you want us to apply your testimony to the next bill?
If you'd be willing to apply my testimony to the next bill, then I can go testify in another hearing. That would be great.
Okay, we got it.
Thank you for your understanding and flexibility. I really appreciate it.
You bet. Thanks for testifying. Any questions for Sarah on the next bill? Okay, thanks. Are there any other members of the public wishing to speak on the amendment 1421S to HB 1639? None?
Senator, I'd also like to say that now it is posted on the general report website. GCTS has gotten back to us and they have posted that.
Thank you, Alan. I'm closing the hearing on this amendment, and we will open the hearing on HB 250, requiring reports by the Board of Dental Examiners, and hopefully Senator Rosenwald is here to introduce her bill.
Oh.
Is she here?
She is.
Good morning, Senator Sherman and members of the committee.
I'm Cindy Rosenwald from Senate District 13. I had signed up to speak to Amendment 1372S, not the underlying bill, but if you'd like me to proceed, I'd be happy to.
Thank you, Senator Rosenwald. I'm sorry, we were introducing the bill. Is Representative Judy here to introduce her bill?
I
No.
don't see him, no.
Okay, yeah, Senator Rosenwald, if you would be willing to introduce her bill, that would be great.
Okay. On behalf of Representative Judy, I introduce House Bill 250, and I'd like to also introduce Amendment 1372S, which is a replace all amendment, if I may speak to that.
Let's make sure that we don't, do we have anybody, Sonia, to testify on the underlying bill?
Yes, I do have someone, so maybe we could go to them and then I'll bring Senator Rosenwald back.
That would be great.
Thank you.
Thank you, Senator.
Mark Thornton registered to speak on the bill.
Mr. Thornton?
Good morning, Senator Sherman and honorable members of the committee. My name is Mark Thornton. I was born in New Hampshire and have been a lifelong resident of Nashua. And before I begin my comments in support of Senate Bill 250, I just want to give a shout out to Senator Fuller Clark. It was a little over 20 years ago, Senator, that you and I worked on a couple of cancer coverage bills that culminated in success, and specifically Cancer Coverage Clinical Trials Coverage Act, and that was to the benefit of many, many cancer patients over the years. Thank you for your service. We will miss you. I currently have the honor to serve as chairman of the board of directors for Gateways Community Services here in Nashua. This is the area agency for commonly known as Region 6. We are charged with providing services to over 3,000 individuals. And over the years, we have provided a wide range of dental services. But in 2012, we needed to reduce our spending because funding had failed to keep up with the cost of services. We continue to provide limited dental care, really aimed at reducing pain and preventing infectious situations. But that's only after all other resources have been totally exhausted. This is paid for entirely through external grants and donations. And in fiscal year 19, I should say, we spent over $50,000. And currently year to date, we have spent over $30,000. And this is completely an inadequate amount to address the needs of our community. And over the years, we have seen the state, unfortunately, spend excessive amounts of money to correct situations that would have been easily preventable. It's an ounce of prevention. It certainly is worth a pound of cure, and this is a prime example of that. It really is our fervent desire to see New Hampshire remain an example of fiscal responsibility, but even more importantly, to see that it cares for their most vulnerable citizens and to really provide an adequate opportunity to achieve an inclusive health outcome. So we certainly encourage and thank you for your support of this piece of legislation. I'd be happy to entertain any questions you may have.
Are there any questions from the committee? Thank you, sir.
Thank you all very much.
Do you have any other?
Michael Auerbach signed up to speak to this bill, but I'm not seeing him right now. So that's all that I have for the underlying bill.
Okay, so we'll close the hearing on the bill and open the hearing on the amendment. I don't have the amendment number right in front of me.
I've brought back Senator Rosenwald.
Right.
Yes, good morning, I'm back. Thank you, Senator Sherman. I'd like to offer amendment number 1372S to House Bill 250. This amendment will help the more than 90,000 New Hampshire adults that are enrolled in traditional and expanded Medicaid. Not only will this benefit improve the health of the covered population, because as we really all understand, poor oral health leads to poor overall health. It will also save money upstream in Medicaid on other health treatments. Specifically, right now, the only current benefit, dental benefit for adults in Medicaid is emergency room costs and emergency extractions. But untreated dental problems lead to much more significant health problems. Maybe a week or two ago, a former colleague of my husband told him that she had a patient in the hospital right then who was extremely ill with a heart valve infection that was caused by an untreated dental problem. So what could have been treated in a dental office was now requiring not only hospitalization, but potentially open heart surgery on that affected valve. I also believe that expanding Medicaid to a dental benefit for adults is an economic development tool for New Hampshire. Working age adults who receive dental care will be less likely to have missing teeth. And I'm convinced this will lead to improved employability and financial mobility. I've been in the legislature now for 16 years, and there has been discussion and a desire to have this benefit for at least as long as I've been coming to Concord. There's a growing acceptance that the benefit's important. And I often hear from the disability community of their desire for the benefit. And you've just heard from two representatives specifically to that effect. I have personally worked with the Department of Health and Human Services and the Dental Society to try to find emergency care for Medicaid enrollees on a hardship basis, but it's very difficult to do. So the language of Senate Bill 754, which is contained in this amendment, directs the department to pursue a managed care model to begin adult dental coverage next April. This timing is consistent with the appropriation in the budget, and the language of the amendment outlines the guidelines for the benefit. It is to include preventive, restorative, and further prosthodontic services subject to medical necessity. Now, I don't want to gloss over the fact that there will be a cost in the next budget, and it's not insignificant, but there will be savings too, immediate and longer term, not just on emergency visits and emergency extractions, but also infected heart valves and potential open heart surgeries. And that phone call that I referenced before, that kind of cardiac surgery could cost $40,000 just for the surgery itself, not to mention the cost of what could be up to 2 weeks, 10 days to 2 weeks in the hospital. And how much would the dental treatment have cost? Well, in a root canal costs somewhere between $500 and $1,000. So you see, we're talking about maybe 1% of the cost. I know there is a desire by some members to delay the start of this benefit for an additional period, another year and a half from now, approximately. I did offer a middle ground compromise of a 3-month delay with a further delay of prosthodontics, but unfortunately it was not accepted. And so I have not drafted that for introduction. I don't want to delay this benefit beyond the current budget because I am completely confident, based on my 16 years in the legislature, that the benefit would not get funded in the next budget, even if we passed the policy with a 9-month delay. In fact, we could come back next year with a new legislature, pass a new bill, and still get it enacted faster than the proposal to delay it until 2022. I just feel strongly that we cannot kick the can further down the road and say we want to do it, but the timing's not right. I believe we owe our disabled, elderly, and low-income residents a better Medicaid program. And so I offer this amendment 1372 to you, Senator Sherman, and the committee, and I hope you will look favorably on it. Thank you very much for letting me testify.
Thank you, Senator. Are there questions from the committee? Seeing none. Sonia?
Sarah Finn.
Welcome, Ms. Finn.
Hi, this is Dr. Sarah Finney. I'm the Medicaid Dental Director. I just wanted to offer my support for this bill. We've enjoyed working alongside Senator Rosenwald to this point, and obviously we realize how important.
Thank you. Is she still with
For
us?
my support, I don't know if you have any questions.
So you are the state Medicaid director for dental, or?
Yes, I'm the Medicaid Dental Director.
Thank you. I apologize for not calling you doctor. Sorry.
That's okay.
Are there any questions for Dr. Finney? Seeing none. Thank you so much for testifying.
Thank you all very much.
The next two speakers were Henry Lippman and John Williams, and I don't see either of them on here. If you are, could you raise your hand? And if you're on the phone, press *9. And in the meantime, let me find someone else. Christine Stoddard.
Good morning, Mr. Chair, members of the committee. My name is Christine Stoddard, and I'm the Director of New Hampshire Public Policy at Bi-State Primary Care Association. As you know, we advocate for better access to healthcare, including oral health, and about half of our 14 community health centers actually have dental operatories. Some of them also run comprehensive programs for kids, and then the remaining health centers contract with their community partners like Easter Seals to provide oral health services. And like medical care, the health centers do this regardless of a patient's ability to pay, and they also provide a sliding fee discount to patients based on income, making their oral health services more affordable for their communities. And like private practice dentists that participate in the Medicaid dental program, health centers receive a fee-for-service payment for oral health services. As you can imagine, that pre-pandemic, the health centers reported high demand for oral health services because there is what I would describe it as an inadequate network for the Medicaid program right now for oral health. And because of the pandemic, those demands for services have increased drastically. The health centers originally shut down their dental practices with the exception of emergency services only. And now they are in the process of expanding those services to people in need of preventive care also. So they've had to change their workflow. They're working to find capital to retrofit their practices to keep patients and their staff safe. And that means that is increasing the delays in patient care and also, again, increasing the demand statewide. The creation of a Medicaid adult dental benefit and the requirement that the state implement a reimbursement other than fee for service will help address the network adequacy issues. However, I would be remiss if I didn't mention the importance of the state loan repayment program as it relates to the Medicaid adult dental program. It's my understanding that the Department of Health and Human Services was going to expand this program to include private practice dentists. However, that funding was swept early on in the pandemic, and we were assured that the money would be restored, but that has not happened, and DHHS has put all new SLRP contracts on hold, which is really unfortunate. So Bi-State and our members respectfully request that you vote House Bill 250 ought to pass for all of the reasons that Senator Rosenwald mentioned and more. And I am happy to answer any questions if you have any.
Thank you very much for your testimony. Are there any questions from the committee? Thank you.
Thank you.
I have John Williams.
John, welcome back.
Senator Sherman, thank you. And I apologize for the technical delay in being able to let you know that I was here. On behalf of the department, Henry Lippman happens to be at Governor and Council, I think that Dr. Finney covered the ground very well. You recall that the department presented at your committee when it was Senate Bill 754, which was voted unanimously out by your committee and then adopted by the full Senate. And then it was pending executive session to the Senate Finance Committee at the time of the suspension. So we are here fully in support of not only the underlying bill, Senate Bill 754, which is a combined effort of the HB4 from the 2019 session, the trailer bill to the budget working group that was established with a collaborative effort to moving this very important issue forward. And we just want to thank you for the opportunity, and I'm available, and also Dr. Finney if you have any questions, but nobody had questions for her, so I think we're all set. Thank you.
Thank you, John. Any questions from the committee? Thank you. Next, Sonia.
Next is Nicole St. Hilaire.
Welcome.
Hi, good morning. I'm sorry, can you hear me?
Yes, we can. Please introduce yourself.
Thank you. My name is Nicole St. Hilaire. I'm a resident of New Hampshire, and I'm sorry, I'm getting terrible feedback on the phone. I think that's because I'm unmuted, so pardon me while I just fix this.
We can hear you just fine. Oop. Did she go away?
She did.
All right, let's go on to the next one and bring her back if she jumps back on.
Okay, Gail Brown.
Yes, thank you. This is Gail Brown. I'm the director at the New Hampshire Oral Health Coalition. And as I stated earlier in the other bill, our goal is around achieving optimal oral health for the people of New Hampshire. We have been working on this strong and steady together with a collaborative multi-sector group. And my testimony is very simple. I would simply like to totally affirm every word from Senator Martha Fuller Clark and from Ms. Christine Stoddard at Bi-State. We work with them both very closely, and they have defined it in words so eloquent. I am not going to repeat them. I just want to affirm them. Thank you.
Thank you. Any questions from the committee? Seeing none, thank you for your testimony. Sonia?
I'm told Nicole is back, so let me bring her in.
There she is. Nicole?
Nope, oh, let me try this mute button. So sorry, I'm having some connection issues today.
You sound absolutely fine to us, so please go ahead.
Let me just, thank you so much then. Good morning. Thank you, Chairman and members of the committee. My name is Nicole St. Hilaire. I'm a Manchester resident and New Hampshire native. Honored to speak to you today in support of House Bill 250 and the amendment proposed today to ensure an implementation plan that aligns with the purpose of improving overall health, promoting savings in the state's Medicaid managed care program, and preventing future health conditions caused by oral health problems. I've been a social worker in the state for the last 20 years, and I currently serve as the Director of Member Engagement for AmeriHealth Caritas, New Hampshire, a Medicaid health plan serving New Hampshire's Medicaid population since September, and the only Medicaid health plan in the state to provide dental coverage for adult members. As a social worker, I've worked with many individuals and families impacted by trauma and the social determinants of health, including poverty. Without access to dental care, many are living with infection and the negative health impacts of disease. Others who have access to extraction benefit for infection may be working age and living without teeth, which has cascading health impacts as well as reduces any chance for gainful employment and a meaningful road to self-sufficiency. I know this because I hear these stories from our members whose health and lifestyle has been improved by accessing necessary dental care. I've heard this from more than one member as they are able to return to work or school after accessing that dental care. AmeriHealth Caritas New Hampshire believes so strongly in the correlation of health and access to adult dental care that we have self-funded a limited benefit for our adult members. We've done this in partnership with the community health centers and children's Medicaid dental providers. The AmeriHealth Caritas New Hampshire adult benefit is based on research that demonstrates the strong connection between oral health and physical health and reflects our person-centered approach to whole family care. Since the benefits launch in September 2019, we have served over 700 members and thousands of services. In closing, I want to thank you all for your support and your time today. June is Oral Health Awareness Month. And as part of our provider recognition, we'll be moving forward with recognition of our providers as oral health champions. And I want to take a minute today and recognize you and thank you all for your role as oral health champions here in New Hampshire. In recent years, our state has worked hard to put the head back on the body through its mental health and substance use disorder initiatives. And today we have the opportunity to put the mouth back in the head by expanding dental care for adults. Thank you, and thank you for your patience.
Thank you for your testimony. I just have a quick sort of yes or no question. There has been some desire by some members of the legislature to delay implementation of this, but it is my understanding that there is, at this point, almost irrefutable outcomes data on the financial benefit, the fiscal benefit of moving forward with this on top of the healthcare benefit. As within your organization, would you agree with that this is not just about oral and physical health and global overall health, but it's fiscally a very responsible move to move forward with this at this point?
Oh, yes, sir. I believe that there is certainly a financial incentive to move forward quickly. The ability to address physical, oral health and behavioral health at the same time will certainly drive down costs overall for the state.
Thank you very much. Any other questions? Appreciate your testimony.
Thank you.
Sonia?
The last speaker I have is Michael Auerbach.
Mr. Auerbach, welcome back.
Thank you, Mr. Chairman, and through you to the membership. For the record, again, my name is Michael Auerbach. I'm the Executive Director of the New Hampshire Dental Society. We are in support of HB 250 as amended by Amendment 1372S. For many years, the NHDS has been strongly in support of an adult benefit. We are very appreciative of Senator Bradley, Senator Rosenwald, of course, and you, Senator, Mr. Chairman, and the entire House and Senate leadership for their support of this concept. We've been working with the HB4 working group for over a year now, in the pursuit of inclusion of dental care in a framework that's broad enough to accommodate a sizable population of patients in need of more complex dental procedures, including root canals and extractions. We do understand that that there are unforeseen economic conditions that were precipitated by COVID-19. We acknowledge that there will be significant fiscal impact of the pandemic on our state budgets, and that those impacts must be weighed against economic and public health benefits. We're looking forward to working with each one of you to find a balance in this issue. As we continue to support the principle of an adult benefit, we are hoping to make this a critical concept of a reality for our patients. We hope that you'll take into consideration the concerns regarding reimbursement rates, care coordination, and patient navigation. We're proud to work with this committee, with all legislators to achieve better oral health care outcomes for our state. We believe that HB 250, as amended by Amendment 1372S, is an important step in moving forward towards this goal. Thank you very much.
Thank you. Are there any questions for Mr. Auerbach? Seeing none. Sonia, are there any members of the public wishing to speak? Do we have any hands raised?
We do. We have Erica Bodwell.
Okay.
Good morning, Senator Sherman and committee. Thank you for indulging me for a third time. Northeast Delta Dental supports this amendment to HB 250 to add preventative and comprehensive adult a preventative and comprehensive adult benefit to Medicaid. We did testify in support of the bill in more detail in March, and we are honored to have been part of the very active work group led by Dr. Finney and Henry Lippman, discussing how this benefit should work. Passing this bill is the next step. Northeast Delta Dental is excited to respond to an RFI and work with the stakeholders in the department on this critical benefit. We agree with the previous testimony that this is ultimately a cost-saving measure and should not be delayed. We do thank Senator Rosenwald for her hard work on this bill, and we are so excited that she has taken it up, even though it's COVID. So thank you very much, and hopefully that'll be the last time you hear from me today.
Thank you for your testimony. Any questions? Sonia, do we have any other hands raised?
Nope.
Any members of the public wishing to speak on this bill? Seeing none, I'll close the hearing on the amendment. And do we have a motion to move into executive session?
So moved.
A second?
Seconded.
Moved by Senator Bradley, seconded by Senator Fuller Clark, and we'll call the roll. Do we have to call the roll for this? We do, don't we? Yes.
Yes.
Senator Fuller Clark, motion to move into exec session.
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. Okay, the first order of business in the exec session is to reconsider HB 1264. Just so everyone understands what we're doing. We moved HB 1264 with, I think we had an amendment on it, but we moved it out last week. And subsequently, the Department of Environmental Services found a problem, and we have corrected that problem with amendment number 1404S. So we need to first reconsider the 1264 as amended so that we can go and amend it yet again.
I move reconsideration of House Bill 1264 as amended.
Second.
I'll call the roll. Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. Do I have a motion on amendment 1404S?
I move on to pass on 1404S.
Second.
And so why don't we have a little discussion? Senator Bradley, or do we have somebody prepared to just explain to us the technical fix?
I don't know if anybody from DES is on the phone, but you and I were both contacted by Commissioner Scott. I actually did not have a chance to talk to him, but I think Josh reviewed this language, and I think it's consistent with what we're trying to do.
And it doesn't change any of the levels or anything else that we're doing in this.
I do not believe so.
Right. All right, so we'll call the roll on the amendment. Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. So I think we have to have an ought to pass as amended.
So moved.
Senator Bradley moves, Senator Fuller Clark
Second.
seconds. Calling the roll. Any further discussion on ought to pass as amended? Okay, Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. All right,
Senator, do you still want, I don't have it in front of me who was going to take 1264 out, but are you okay with just having that?
yeah,
same?
we'll just keep it the same.
Okay.
Also for our attendees and members, this has been posted on the general court website as well.
Okay, thank you, Alan. Moving on to 1246, relative to reporting healthcare associated infections. Do I have a motion, Senator Fuller Clark or Senator Cheney?
I move on to pass on 1246.
Do I have a second? I'll second that. And we have an amendment to 1246. Actually, we have a little discussion on this.
So Tom, do we need a motion to address the amendment?
Well, there's actually, we have two amendments available. Remember, we had talked about adding 570 to this bill, which is the training nursing assistants. So
move.
I would request that we add 570 to the omnibus health bill.
Is there a discussion on that? The omnibus health bill does not talk about nursing homes, whereas this one does.
I think that if you're worried about germaneness, Senator Sherman, there clearly are enough healthcare related issues that just about anything that's healthcare related would be germane to our omnibus amendment.
I think we have an amendment with 570 incorporated into the amendment for HB 1246.
Yes, with the percentage change that was listed. I will.
Change
right
that
now.
was listed. So if you look in your inbox at 1424S, is that correct, Monica?
Yes, and I'm sending it again to everyone right now.
It's 1424.
Yes.
Okay.
So,
And what it does is it basically makes the changes to the percentages that were specified before.
right. So it makes the change to the percentage of 275% of federal poverty guidelines, and it adds SB 570 to the bill. So we could move the original amendment, or we could move this one. I would support moving this one, and because 570 is more germane to this bill.
So I move amendment 1424S.
I'll second.
Okay. Is there discussion?
Yeah, I'd like to discuss it for a moment.
Senator Bradley?
Okay, so I just want to reiterate what Ms. Rounds of the department testified to earlier this morning, that already of the CARES funding, a $300 stipend has been paid to long-term care workers, and out of the healthcare fund that I believe is separate from the CARES funding that is discretionary, some $25 million has gone to the long-term care facilities. There have been stipends for DCYF workers and money added for DCYF and domestic violence programs, as well as money added to childcare. These have all been part of Governor Sununu's executive orders. When all is said and done, I believe that of the $1.25 billion that is somewhat discretionary, as long as it is COVID related, there is approximately, after the Main Street Relief Fund, $400 million remaining. this amendment and several of the other amendments that are attached to other bills taken in pieces would dedicate that money right now to different initiatives, some of which I think is well warranted, other of which just in the overall ability to use the 1.25 billion may not be the highest priority. And we don't know what kind of future stimulus there may be coming from Washington. We do know that these funds have to be expended by December 31st of 2020. And we don't know a lot of things with regard to whether there'll be a second wave of the virus and what might happen there. I think we need to be careful with the remaining $400 million. Obviously, things have reopened in New Hampshire, and I think that's been successful. But at the same time, to appropriate this money now without it being part of a comprehensive plan, I think is premature, and therefore I would urge a no vote on this amendment. And I would also ask that Senate Bill 570 again be attached to the Sherman-Bradley amendment, as that is a bipartisan amendment, and it is without controversy. There's no way of foretelling what will happen with House Bill 1246 and the amendment that we're discussing now.
Thank you, Senator Bradley. Is there further discussion? Seeing none, we'll call the roll. Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
No.
Senator Gray,
No.
and I vote yes. So we need an ought to pass as amended vote.
So
Sorry.
move on to pass as amended.
I'll second.
Further discussion? All right, Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
No.
Senator Gray,
No.
and I vote yes. So moving along. I will,
Senator, who would you like to have take that out?
Senator Fuller Clark, would you be willing to?
Yes.
Thank you. Okay, so moving along to HB 1639. Do I have an ought to pass on the bill?
I'll move that ought to pass.
Second.
Okay. Now we have an amendment. The most recent amendment needs a little bit of
Tender
work.
loving care.
Tender loving care. So I have a list of tender loving care here. So this is amendment 1421S. So we need a motion on the amendment.
I'll move 421S.
Second.
421S.
Okay, and now if we can walk through, I'll do my list, and if I miss something, let me know. So the first is on page 2, section 5, lines 26, and actually it goes down to page 3, line 3. So it's section 5 needs to be deleted. And then the amendment renumbered. Monica, you have that?
I do.
Okay. What I'd like to do is walk through these, and if there's no objection, we'll do this as a single committee amendment rather than voting on every single one.
Sounds
So
good.
do we have consensus on that one as a go-ahead?
Yes.
Yes.
All right. This next one is add back. There's a paragraph. Oh, Lordy. And in the original, in the calendar. So that's the amendment 1386S. And in this amendment, it's
I believe it's page 2, line 15
in what?
in the amendment 1386S, the section 4.
Okay, I'm just looking at the calendar, which doesn't have line numbers.
Oh, okay.
So it's under, it would be under what we currently call section 51 on page 27, line 10, coverage for certain biologically based mental illnesses. And we need to restore paragraph Roman 5 hyphen B period, open parentheses, B, close parentheses. And it starts with the sentence, compliance with subparagraph A. So that does two things to this, to the amendment we're working on page 27. It will change in section 51, Roman V should be Roman V hyphen B, open paragraph A, close paragraph. And then under that section, after line 25, between line 25 and 26, there would be inserted paragraph B, which is open parentheses, B, close parentheses, and it starts with the words compliance with subparagraph A. Do you have all that, Monica?
So let me just jump in here to try to make it easier for everybody. If you're looking at the calendar amendment, it's at the bottom of page 276.
Right.
And it's
56
1,
feet.
2, 3, 4, 5, 6, 7, 8, 9. 9 lines long. And as Senator Sherman said, it starts with compliance with subparagraph A shall not constitute compliance with the Mental Health Parity and Addiction Equity Act. And then it goes on.
Right, and that just needs to be inserted between lines 25 and 26. So
That's
before-
correct. The one thing that I would note, Senator Sherman, is when OLS in our amendment, section 51, they broke out A into A, B, and C.
Yeah, that'll have to be 1, 2, 3, I suspect.
Probably. So just, Monica, I think just make sure it's the language at the bottom of page 276, and it's right before in the calendar amendment, section 57. Okay?
Yes, so it's like compliance with subparagraph A shall not constitute compliance with the mental health parity, correct?
That's correct.
That paragraph gets
I just want
inserted.
to be clear where we're inserting it.
Right, it goes right before.
Between line
section
25 and
52.
26.
Yeah, between lines 25 and 26.
Of what
On-
section though?
On page 27 of the Sherman-Bradley amendment.
Okay, thank you.
So it is the second paragraph of section 51.
Okay.
So it goes before section 52, and we can double
Gotcha.
check this. All right, do we have consensus on that paragraph coming back in?
Yes.
Okay. So the next one is page 4, let's see, page 4. This is Heidi Kroll had requested that we correct the RSA location. This is on, sorry to be jumping around, but sort of the way the request.
It's line 25 of the Bradley Sherman amendment on page 4.
Right.
So we would change the reference to RSA 417.4.
Yeah, to the language which I had.
It's RSA 420J8.
Right.
That's the correct reference.
It's actually it should read. It would read amend where it says
On line 25, where it says amend RSA 417.4, it would be changed to read amend RSA 420J8.
yeah, by inserting
Right. The rest of it is fine.
not according to
believe.
her. Yeah, she has it reading, here's the exact language, Monica. Amend RSA 420-J by inserting after RSA 420-J :8-E the following new section. Or the following new paragraph, sorry.
Okay,
Yeah.
so she's changing the paragraph 23, but why would that be?
It just, according to the negotiations that occurred yesterday, they realized that this language that they want added, because it's a new paragraph, should go in the proper place in the statute, and it's RSA 420J8.
Yeah,
Yeah. So Monica, continuing that, we actually have to change it a little bit more. So remember where I said 8-E? Do you have that? Are you at that point, Monica?
I'm looking at the Bradley Sherman amendment and I'm gonna be having OLS have amend RSA.
I just, yeah, you're
But it's gonna be,
you're
sorry.
going to replace language
yes,
in lines 24, 25, 26, and 27.
yes.
So the new language, I read up to 8-E. Do you remember that?
Yes.
And then it should say the following new section, colon. And then RSA 420-J :8-F. And then come the words non-covered dental services contracting. And this is in the email from Heidi, which I can forward to you. But that's the exact wording that needs to go in there. Okay. Is there an okay from everybody on that one? Okay. There was, yeah, that one we're going to skip. So the last component of this, which we had agreed to, but it had not been inserted, was to insert the consent wording from Matthew Hood. And I have that, I think you have that as well, Monica, don't you?
Yes.
So I'm going to read that quickly
That goes
for
where, Tom, again.
that would go at the end, I would think. It's a new section. And it's added to RSA 137-J:5. I'm going to read this as quickly as I can. What this basically does is it takes the emergency order and it puts it into effect through July 1, 2021. And this is the emergency order that allows people to be consented for research protocols as a life-saving measure as a result of COVID-19. Right now, they would need a court order or a guardian to do that, but many people don't have that. They have a durable power of attorney and otherwise, and so those don't count according to statute. So for this was a huge problem in getting people who sort of as a last effort, who are on a ventilator and unresponsive, to be able to get them in a timely fashion into a research protocol to save their life. So what this says, E, notwithstanding the prohibition in section D, for any patient experiencing severe advanced COVID-19 symptoms or COVID-19 complications who does not have the capacity to consent himself or herself to an experimental treatment, an agent or surrogate shall have the authority to consent to experimental treatments authorized by an institutional review board on the patient for COVID-19 symptoms or complications. Subparagraph lowercase Roman I or 1, for an agent or surrogate to approve the use of an experimental treatment approved by an IRB, the agent or surrogate must be informed of all risks and side effects and follow all institutional review board instructions regarding the consent as if the agent or surrogate were the individual receiving the treatment, including the completion of all consent documentation required by the Food and Drug Administration. An agent or surrogate shall not consent unless the following 3 factors exist. 1, the patient is confronted by a life-threatening situation necessitating the use of an experimental treatment. And 2, informed consent cannot be obtained from the patient because of an inability to communicate with or obtain legally effective consent from the patient. And 3, there is no alternative method of approved or generally recognized therapy available that provides an equal or greater likelihood of saving the life of the patient. Roman lowercase 2. If a patient has a living will, the agent must follow the directions of the living will. In addition, if the agent or surrogate has actual knowledge that the patient wished to decline the experimental treatment, the agent or surrogate does not have the authority to consent to treatment. And then F is section E is repealed, effective July 1, 2021. Are there any questions on that? And is that everybody's okay with that? So there had been some other suggestions to go into this very large omnibus bill that we all heard. Did anybody have any other additions?
So
Anything that I missed?
I'm going through the critical access hospital piece, which I believe is section 59 on page 38 of the bill. If you recall, I said there were some typos.
Yeah.
I'm trying to identify them now. I think the first one is on page 38, line 3. After provided, line 38, after following and before provided, after, before.
I'm just pulling
I
up
think, means
do you remember what the bill number was?
Yeah, 519.
I had that up here. Hold on. I'm just trying to find it.
Said we're on page 38.
Yep. All right, so I think in that definition A, was a request for the word currently between following and provided.
Where is this?
So the very first sentence,
Yeah, the very first sentence on page 38, no, I'm sorry. It's line 3 in the definition of healthcare services.
Right.
And it should be any of the following currently provided.
That is correct.
Okay.
Yeah, I'm looking at the original that this came from.
Yeah, so am I.
Okay.
Let's see. Page 38, line 8.
Let's just make sure that Monica is keeping up with it.
I have that one. Thank.
Okay. Line 8.
Are you going on mute?
That looks correct to me. Except it's missing the word the.
It's missing the word the after
Between
providing.
providing,
Yes.
yeah. Okay, so line
I don't
8,
know that that's critical, but that was a mistake.
I think it is critical.
Okay. All right. Fine. I'm good.
Is that it?
Then on the next page, this is a spelling on line 25. It should be at,
Rather
do
than-
so at its own risk.
Yep, typo. Get that, Monica?
39.
Page 39,
Page
line
39,
25.
Oh, 25. Okay, sorry. Line 20.
I'm just going back and forth, and I apologize. I could have done this earlier, but I didn't.
Well, none of us could do it earlier.
Yeah. Can we come back to this in a minute? And, oh, wait a minute. I'm sorry. On line 25, page 38, line 25 and 26. Add the state in conjunction with after the word of.
Where's that?
Line 26. I think this is the new language that you had added.
Which page is that? 40?
38.
38. Line,
I'm sorry, line 39, page 39. And it's line 26.
line 26. So the question there is,
so Jeb, can you tell us again what we're adding there?
It's supposed to be the state in conjunction with, but I'm trying to figure out exactly where it's supposed to go. Line 26. The applicant shall,
no, the state in
the applicant shall bear all costs of the rehearing.
Oh, it's missing the state in conjunction with.
Yes.
So the appellant should bear all costs of the state in conjunction with any rehearing.
Yes, I believe that's correct.
Should it be all costs to the state?
Upon, by the hospital association and Convenient MD was the state in conjunction with the appellant shall bear all costs, and then we would add in of the state in conjunction with.
No, it's in connection with, not conjunction, it's connection. I'm looking at the agreed language.
All right, okay.
So the appellate shall bear all costs of the state in connection with any rehearing.
You're right, Tom, you're right, sorry. Yeah, I just pulled up the sheet that you and I were working off of over the weekend.
Right.
Okay.
So Monica, did you get that? Line
Yep.
26, page 39. The appellant shall bear all costs of the state in connection with any rehearing.
Okay.
All right. Any others, Jeb?
Nope.
Okay. With that, is everybody in agreement on the changes that we've discussed so far?
Yes.
Yes.
Okay, so
And
what
we've
I
added
think,
the Matt Hood language, right?
yeah.
Okay.
So what I'd suggest is that it's my understanding that if we, rather than getting into adding more stuff at this point, we can discuss that and potentially do a floor amendment. But since we are all in consensus and we are at this hour, we have to be done shortly. I would like to move forward with a vote on this committee amendment and then move this forward.
All right, I'll move the amendment with the changes that we've just outlined. Understanding, I think, Senator Sherman, that you and I ought to have a conversation about Senate Bill 570.
That's
And I
fine.
think it's Senate Bill 549. So it's the rebuttable presumption
Yep.
and the training of nurses. Okay,
Yep.
those two issues may need to find another home. And I think there's support, obviously, across the aisle for both of them.
Yep.
But we need to make sure they are protected. Let's put it that way.
I agree to that agreement. All right, Senator
I've
Fuller
moved
Clark.
ought to pass on the amendment with the changes.
Right, okay. Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. So
And I'll
we
move
still-
ought to pass as amended.
Second.
Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and Senator Sherman. Yes, well, that's me. I knew that. I was just kidding around. Okay, so we've got one left to go, correct?
Yes. And if you'd like, I'll move on to pass on HB, is it 250?
Yes.
Yes.
I'll move on to pass HB 250.
Second.
Right. And I will move ought to pass on the amendment.
Second.
Okay, discussion on the amendment.
So if I might, I would just like to be able to introduce an amendment that, for consideration, changes the dates. So would you like to, Senator Sherman, adopt? Probably the easiest way is if we adopt the amendment that's being discussed right now, and then I could offer my amendment.
Yep, that's fine. Is there any discussion on, I'm just looking for the amendment number and I'm not finding it quickly.
It is 1372. Yes.
Thank you. Amendment 1372.
Nope. I'm good to go.
Okay, so let's see. Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. Okay, Senator Bradley, you had some modification.
Yep. I believe that the amendment has been emailed to everybody. It's a very simple amendment. It just changes the effective dates of the 3 effective dates that were in the law. And it also adds a 4th effective date. So if you have the amendment, the first change is the request for information would be extended out from August of 2020, excuse me, to May of 2021. Then the second change is the state plan amendment that has to go to CMS would be extended out to August 1 of 2021. And the third change would be the implementation date would move from April of 2020 to January 1 of 2022. And the fourth change would be to move out the prosthodontic coverage to July 1 of 2022. Here's why I am proposing these changes. I think that, I believe it was Mr. Auerbach, when he testified, cited the changing financial circumstances. I'm looking at the May New Hampshire revenue focus. We're already $100 million short in fiscal 20. The estimates are that, you know, by the time the fiscal year is over at the end of June, it could be as much as $150 million. And fiscal year 2021, which starts on July 1st, right now at least, is even more difficult. The cost of the dental benefit is estimated to be between $6 and $11 million. I am troubled by promising something that we may well not be able to fulfill a promise as we contemplate the impact of COVID on the state's revenue picture. It's very uncertain if there'll be a fourth stimulus package that would allow backfilling of states' revenue losses. It's possible, but I unfortunately don't know that we can count on it. And I don't know that we can count on the economy recovering to the extent that we would need to be able to pay for a $6 to $11 million benefit that starts in this biennium. So what my amendment does is it doesn't end the dental benefit. I don't believe that we should do that. I, along with Senator Rosenwald and Senator Susi too, have worked long and hard to put a Medicaid dental benefit for adults, you know, on the must-do list. I still consider it a must-do item, but the state's fiscal situation just needs cautious watching, and delaying this 9 months gives us that opportunity to watch cautiously and make an assessment as the next legislature is putting together the next budget, how we can do it, how we can phase it in if it needs to be phased in, or if the economy has recovered in a good fashion and approximates what the economy was before, you know, the shutdown order of around March 15th, we should be able to go ahead as planned. And that would be the best outcome. But I think a dose of caution is important. I don't think it should be interpreted in any way, shape, or form to mean that those of us that might support this amendment think that the dental benefit should go away. It doesn't mean that at all. It just is recognizing the situation that we're confronted with right now that is very uncertain. As I said before, when we were, you know, discussing, you know, we just don't know a lot of things with COVID, and how that's going to affect the economy is certainly one of the biggest things. And so I think caution would be appropriate here. So I would hope that there can be bipartisan support for this amendment. I don't believe it should be a painful pill to swallow. The painful pill to swallow would be a promise of something that we cannot deliver because the revenues just don't meet what we need to have to be able to go forward with a $6 to $11 million initiative. I do agree with Senator Rosenwald. There will be cost savings. There'll probably even be significant cost savings, but in the way legislation gets scored by the legislative budget assistant and the fiscal note, those savings aren't calculated because I don't know that other states have been able to calculate those savings. We know they exist. We know it improves health. And as somebody, quite frankly, who, spearheaded the drive for Medicaid expansion, no one knows that better than I, but there has to be a recognition of the situation fiscally that we're in. So I hope that we can support it. I believe that will protect the dental benefit in the long run. And I commend it to everybody.
Mike, I'm sorry.
Second the amendment,
Okay.
and I would like to speak to it.
Go ahead, Senator Gray.
Senator Bradley and I, in discussing these dates and pushing it out 9 months, I don't think 9 months is sufficient time. But I don't know that I would get any agreement on doing that. Right now, return on investment is what we're looking at. Is that if we spend, I'll say $6 million right now, when is the return on that investment? And when your pocketbook is almost empty, is not the time to go spend another $6 million. So pushing this out so that it will get reviewed by people when they're doing the budget next year, and making sure that we do have the money. I know that Senator Rosenwald in her testimony appeared to say that she didn't believe it would get included in next year's budget, and that is another reason. If it's not worthy enough to get included in next year's budget, I don't understand why, when we're in a very precarious position when it comes to budgets, that we're talking about spending that $6 million. Thank you.
There we go. Thank you, Senator Gray. I'll speak on return on investment. Some of this may be slightly delayed, but not very long. If you're looking at the cost of a heart valve replacement, or you're looking at a loss of life, that's priceless. And we know absolutely, there's zero question that the health benefit, not just on oral health, but on the global comprehensive health of every patient, much of it starts with their oral, the quality of their oral dentition and their oral health. So I can't support a delay. I think a delay is also a delay in providing services to people who, this does become significantly life or death, especially in the face of COVID. We know that people with poor dentition don't do as well in the intensive care unit, that seeding of the bloodstream from poor dentition is a significant factor in mortality in ICUs. So, and the cost of a prolonged ICU stay because somebody has poor dentition and then is sick is astronomical. But the cost of prevention is much smaller. So I would not agree with delaying this, and I think it is money well spent. It would be helpful if we had more money from the CARES Act to allow us to do this, or from future federal legislation, but I don't think we can afford to delay this critical component of healthcare.
Senator Sherman?
Yes, sir.
Again, my thing about return on investment is not that it will never get paid back, but that if I have an oral health issue that is I'm dealing with right now, that it is likely that it will be years, according to the dentists that I have talked to, before that will progress into a heart valve condition, as we heard before, or some of those other things. And I have no doubt that in 5 years, 10 years, or whatever, that it will be a benefit, and I would support it. But the problem is right now is the amount of time between having a person in the earliest point that this could be implemented, and when that person, if they were not treated, develop one of these conditions that would cause them those problems, is a long time, according to, again, the dentists that I've talked to and some of the doctors that I've consulted with. So it's not that it won't, and it's not that you can't cite a person who, because of dental health, develop these conditions, but there is a lag time, and that is when the return on investment. How many years will it be when I finally say I'm going to do this, and do we have the $6 million? And I don't believe we've got the $6 million.
Is there any other, anyone else wishing to speak of the senators? Senator Fuller Clark?
Yes, I'm concerned that with the delay, that we're going to continue to see individuals in the state being denied dental care that they need, and that they need it now. We've put this off for way too long. I understand the COVID crisis that we're in, but I also understand that we are seeing increased dental demand as a result of the COVID crisis. And I think that we should move this forward. We're going to have to ultimately revisit our budget for the coming year. And I would like us to be in a position where this is seen as a healthcare priority.
Thank you, Senator Fuller Clark. Any further discussion? So we have an ought to pass on Senator Bradley's amendment. I'm going to call the roll. Senator Fuller Clark?
No.
Senator Chanley? I'm sorry, I couldn't hear you.
Sorry, no.
Senator Bradley?
Yes.
Senator Gray?
Yes.
And I vote no. The motion fails. So we have ought to pass as amended. Is there any further discussion?
Yeah, I would just say this. I think it's unfortunate that we couldn't agree on an amendment that both implements the dental benefit, but also recognizes the COVID crisis. I'm going to vote for the bill as amended, despite my reservations. I do it in the sense of trying to find bipartisan cooperation, but that doesn't mean, Senator Sherman, I'm not going to reach out to you between now and Tuesday when this bill is on the floor to try to find something that ensures that we do both things. Implement a dental benefit, but also recognize the financial situation of the state. So be prepared for that conversation.
I look forward to it, Senator Bradley, and I would include Senator Rosenwald in that discussion, since I know you all have been working on other ideas. So
I'll let you, since you're more technologically adept than I, arrange the conference call with the three of us.
Absolutely, Monica, you got it. All right, we have ought to pass as amended. Senator Fuller Clark.
Yes.
Senator Chanley, there you are.
Yes.
Senator Bradley.
Yes.
Senator Gray.
No.
And I vote yes. And I believe, unless Sonia or Monica corrects me, we have no further business in the executive session except for a finger from Monica.
We have two things. First is I need to know who's taking out the bill.
Oh, right. Okay.
Okay.
And I'll take out the other one.
Okay, but then the other issue is I got wording from New Futures that related to the bill we just voted on, House Bill
Right.
1639.
Senator Bradley and I will look at that wording along with 570 and 549, and we will see if there's something more to be done. We'll work with the committee, and if we have to, and with the leadership, and we'll see if there's another place to put these things.
Yeah, and let me just add this too, that Senator Susi has made it very clear that the agreements that have been reached, you know, so that a lot of the bipartisan legislation can move forward. If there are bipartisan amendments, they too can move forward. So I just want to make sure everybody who's on this call knows that.
Right, but I would prefer we don't go back into executive session on the last bill.
Well, I think that's probably over at this point.
Right, so I will take out whatever the number of it was, the omnibus.
Okay.
Okay, any other, do we have a motion to come out of executive session?
So moved.
Second,
Okay. Senator Fuller Clark,
yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I'm vote yes. I'm closing the hearings for Senate Health and Human Services. Thank you all very much.
Thank you.
Well done, everybody.
Oh, let me just add, and I've said this on all these Zoom meetings, since some of the staff have not heard this before, you guys have just done a fantastic job. Can't say that enough. I know how hard you're working, and thank God you're more technologically adept than I am.
I second that.
You're
So
here.
it's unanimous.
Great
You guys
job.
are awesome.
Pull this together, and for every other committee too.
Right. I think you're going straight into one, so go grab a quick bite. Bye, everybody.
Thank you.